hello, Council, and hello to all of the viewers, all of the residents in Cornwall. Bonne année, Happy New Year. We are having a meeting this evening entirely by Zoom, so this is new for viewers, a little bit new for us. Some of the councillors have been on Zoom for previous council meetings, but tonight we are entirely virtual. I am sitting in my office at City Hall. I'm very fortunate. I have a large office, large space here where physical distancing is quite appropriate and attainable. I want to let viewers know that Dr. Paul Remiliotis, our Medical Officer of Health, is going to join this council meeting at about 8 p.m. So I will expect Madam Clerk to alert us as to his impending arrival so that we can prepare to have him come and present to us. He has asked for about 30 minutes to present, but of course that may take the time that it takes, and of course Council will have every opportunity to ask questions. I also want to let all of you know, viewers and Council, that I had a meeting this afternoon with the elected officials in our area, meaning the wardens for Prescott Russell, Warden Sarrazin, Warden Prévost for SDG, Stormont, Dundas, Glengarry, and Grand Chief Abram Benedict. We met so that we could review our declaration of emergency. You will recall that we did that as a region. We also wanted to talk about COVID-19 status in our region, also about how municipalities can and will support a vaccine rollout process in any way that we can. And the next steps are likely to see if we can meet with our CEOs of the local hospitals so that we can get a further understanding for our community, for ourselves, as to how hospitals are doing throughout this process, and again, how municipalities can help in the vaccine rollout process. So I will keep you all posted as to the next steps there. Let's start this meeting with a moment of personal reflection. We usually stand, but we will do so seated. Thank you. We are not going to sing the national anthem at our Zoom meeting, but I have asked Councillor Hébert to assist us by using one of her many devices there. I know that she's very well connected, to play us the national anthem so that we can start our meeting that way.
Sure.
Thank you, Councillor Hébert.
So if it works.
Yes. Merci, Councillor Hébert. Much appreciated. We acknowledge that we are gathering on the traditional territory of the Mohawk people of Akwesasne. Madam Clerk, roll call.
Mayor Bernadette Clément.
Présent.
Councillors Éric Bergeron.
Présent.
Claude McIntosh.
Présent.
Sid Gardner.
Here.
Councillors Dean Hollingsworth.
Present.
Caroline Hébert.
Présente.
Maurice Dupel,
Present.
Councillors Glen Grant, Councillor Glen Grant,
Present.
thank you. Councillors Todd Bennett,
Present.
Elaine McDonald,
Present.
and Justin Towndale.
Present.
All present, Madam Mayor.
Thank you. Any additions, deletions, or amendments? Councillor Hollingsworth, then Councillor Bergeron, and then McDonald.
Thank you, Your Worship. I would like to remove item 1 under consent reports, Belfour Estates subdivision. I would like to move that to communications, so I would like to move it out of consent. And I would also ask if during the bylaws, the reading of the bylaws and the third reading of the bylaws and subsequent vote, if item number 1, also the rezoning Belfour Estates, be voted on separately if that's possible.
Madam Clerk,
I have
Has
those
nodded.
notes. Thank you.
Councillor Bergeron,
Yes, thank you. I also wanted consent item 1, but also consent item 3, the petition on Riverdale Avenue, to be into communications, please.
and Councillor McDonald.
Thank you. And I'd like to move that we take number 5, item number 5 under consent and move that to communications, please.
Any other additions, deletions, amendments? Madam Clerk.
I have one addition, and as you mentioned earlier in the meeting, Madam Mayor, we will be having a presentation from Dr. Paul, so that is being added to the agenda. Also, an amendment, the budget presentations now appears under new business, but it's actually a notice of motion, so it will be read this evening as a notice of motion and be added to the agenda as a resolution on the next agenda.
Thank you. So we'll need a motion to approve the agenda as amended, moved by Councillor Bennett, seconded by Councillor Garden. All in favor? Carried. Any disclosures of interest? Councillor Hébert?
Thank you, Madam Mayor. I don't want to disclose necessarily a conflict of interest, but in our first presentation this evening, there will be reference to the Food and Agriculture Advisory Council, which used to be a program under the Social Development Council, of which I work for, but it is no longer a program of the SDC, but it certainly will be mentioned. So I'm not disclosing conflict of interest, I'm just disclosing it before the meeting gets going.
Thank you. Any other disclosures? All right. Seeing no further comments, we'll go to Committee of the Whole. If I can have a motion. Councillor Grant, Councillor Hébert, all in favor? Carried. We have minutes. The meeting of Monday, December 14th, 2020. If I could have a motion, Councillor McDonald, seconded by Councillor Dupel. Any discussion? All in favor? Carried. Madam Clerk, presentations.
We have no presentations this evening, but we do have a delegation from the Eastern Ontario Agri-Food Network, and this evening, joining us on Zoom for the presentation is Mr. Tom Manley.
Welcome to City Council, Tom Manley. It's good to see you. Welcome to our Zoom meeting. I understand that you've been in contact with the clerk. You've been told that you have about 10 minutes for your presentation. So please go ahead. There will certainly be questions from councillors following your presentation.
Thank you very much for the invitation. I'm quite pleased to be here. I am currently the Executive Director of the Eastern Ontario Agri-Food Network since the beginning of November. And my purpose here today is to propose annual core funding from the City of Cornwall along with SDNG and Prescott Russell for the annual operating budget of the Eastern Ontario Agri-Food Network. A wee bit of history. Back in 2009, I was actually part of the volunteers from the region who put together the first local food map, and the logo you see there, SDNG Farm Fresh, to promote local food to consumers and recruit farmers. That, however, did not repeat itself a second year for lack of annual funding, which is a frequent problem. For lack of annual funding, projects tend to be ad hoc, annual, not repeated, and lack of momentum and sustainability for any kind of community organization. The Eastern Ontario Agri-Food Network was formed shortly after that in 2010, has been largely active in Prescott-Russell, somewhat active at SDNG. It published a second agri-food map in 2014 using the same logo that you see there, but slightly modified. I trust that you do see this presentation, is that correct?
No, I was about to stop you. It's not screen shared right now. We have copies because you provided our council with copies, but the community is not seeing that.
Okay, I was told that I should not share my screen, but I will do that now.
Madam Clerk?
Can you see it now?
No.
Here, I'm going to share my screen. Oh, I'm not able. I don't have the permission to share my screen.
Yes, that's why I'm turning to Madam Clerk. She's the host.
I still do not have permission. I was told by one of your organizers that I would not be able to share my screen, that someone there would do it for me.
Okay.
Can you
I
see the
still do not have
presentation
permission.
now?
No. Mr. Manley, do you want to continue presenting and then if the clerk...
Sure.
Yeah.
I will do that. So, despite the fact you can't see it, you have received it in advance. So the EOAM was active for a while, but retreated back to Prescott-Russell for lack of ongoing funding between SDNG and Cornwall, because in fact, the counties of PR did fund the network annually for the last 10 years. In parallel to that, there have been ongoing activities of local food development, as Caroline mentioned, developed by the Social Development Council. Things such as the Green Food, the All Things Food program, the Green Food Box, and so on. And in particular, the FAC was put together, the Food and Agriculture Advisory Council, which produced a plan in 2018 with a series of recommendations on the subject of local food. And I'm going to change page. That report was presented to this same council on May 27th of 2019, just over a year ago. The number one recommendation was the establishment was to establish and coordinate a regional food organization to connect farmers, processors, and consumers and develop the local food movement. However, that has not happened until then because we're kind of stuck in between nowhere land until such time as the Eastern Ontario Agri-Food Network picked up at a pace and accepted the challenge to fill that gap. Having presented its report, the FAC actually disbanded last year, ceased its operation, and therefore I was hired as executive director of the network, and here we are talking to you again today. Just to understand the subject of agri-food, we must recognize that it is in fact the largest economic sector in Canada. Agri-food employs about 12% of the workforce. It actually employs about 16% of the manufacturing force. It's the largest manufacturing sector in Canada. It represents 10.1% of consumer spending, second rate after housing. So economic impact of food, local purchases, long distance purchases, manufacturing, consumer spending are huge. And in fact, it is a sector in our economy where we find a very large concentration of small businesses, startup businesses, and so on. I had the pleasure of witnessing the new company startups with the Cornwall Business Development Center, and several of them were actually in the food sector. Cornwall consumers want to connect to local farmers, and those local farmers in SDNG, 12% of them sell directly to consumers, 178 farms. 44% of the farms in SDNG represent less than $50,000 in annual sales. So we do have a very large small business farm sector that does want to connect to consumers, but do not have that capacity. We understand that Cornwall's economic development objectives are varied. We want to retain population and workforce. We do want to revitalize the economy in a post-COVID situation. We want to build jobs with a focus on the small business sector. All of those bring me to the subject of local food. By building a local food brand, a culture, and awareness, it creates a great place to live, relationships between small businesses and consumers. It retains more of the food dollar being spent locally in our community, as opposed to being set out long distance for wholesale supplies. And a local food scene and a reputation and a brand will attract Quebec and Ontario agri-food tourists off the highways, and not just into our restaurants and hotels in Cornwall, but also to our small food vendors around the region. I think of Upper Canada Creamery in Morrisburg area. I think of Glengarry Fine Cheese in Lancaster, and several others in the region. Cornwall already has a developing food culture. For example, Eco Farm Day, the organic farm conference that Bernadette has attended a couple of times in the past, goes on every February in Cornwall for several years. Cornwall and the area has been host to the Eastern Ontario Garlic Festival every year. It did in fact happen as a market at the Lamoureux Park this past summer. And we know the subjects of Rib Fest, the Food Fest, and several other things happening in the Cornwall area that help to connect. We want to do more to connect those small farms, processors, local brands, and those consumers. We have several challenges to deal with. Our number one challenge is that a lot of people assume that agriculture is taken care of. Well, I will amend that statement saying that large-scale agriculture, commodity agriculture is taken care of with provincial policy, support programs, crop insurance, commodity associations, federations of agriculture, and so on and so forth. However, the small-scale agriculture is not well taken care of because it happens very locally. It happens out of the radar of large-scale organizations. We do not have a local abattoir capacity around Cornwall and no federal abattoir. We do not have the capacity for microprocessors to use inspected kitchens because we do not have a regional policy working with the Eastern Ontario Health Unit to operate shared inspected kitchens. We do not have a local food distribution capacity, so a producer in Lancaster can connect not just by themselves, but through efficient distribution to consumers in Cornwall. We have a very limited ad hoc local food marketing effort, such as the maps I referred to before, but for lack of ongoing funding, it is not sustained. And we have limited capacity to reach out to large urban centers in our region, such as Montreal, Ottawa, Toronto, and the international tourists traveling the 401 and the 417 to get off the highway and to come in and to appreciate our local food entrepreneurs. And we also have a lack of farmers markets that connect those consumers. And in the agri-food sector, sadly, there's a lot of jurisdictional and commodity silos, where the beef farmers don't talk to the poultry farmers, who don't talk to the market gardeners. The Eastern Ontario Agri-Food Network, being around for the last 10 years, has experience and infrastructure. We've been active in PR, somewhat in SDNG and somewhat in Cornwall. We have a lot of accomplishments to be proud of. Printed and online food asset maps, for example, so consumers can find the producers. There are 3 local food counters in Castleman, L'Orignal, and in St. Albert that advertise with video displays and signage the presence of local food to attract those consumers visiting those retailers. We provide operator training and networking so farmers and processors can develop their skills and connect with consumers throughout the supply chain. We have agritourism tours. Sadly, in 2020, they had to be canceled. We had been planning the agri-art tour in the Cornwall area and in the north part of the region, and we're going to put that back on the table in 2021, now that we know how to organize activities, public events with a COVID protocol. We have held in the past local food festivals. The La Foire Gourmande, for example, was a popular event. There are feast to table events happening throughout the region over the years, and the Eastern Ontario Garlic Festival that we mentioned before. And we provide technical services to operators such as food label production for nutritional labels. Going forward, if we had funding from the 3 municipalities in the region, PR, SDNG, and Cornwall, we will be able to do a number of things. For one, with matching grants, apply for government grants, with matching funds, that is. For example, we have applied for a program with the Ontario government at OMAFRA. It requires 50% matching funds. If the organization does not have the core funding, we go nowhere. With core staff and stable infrastructure and stable services to the public and to the operators, we can deliver value on an ongoing, sustainable basis. improve the collaboration and network between the agriculture silos, build the capacity and the training and the abilities and the technical capacity of food operators, develop that food brand, the food recognition, and the culture, comparable to other regions we know across Canada. Food tours and festivals, policy addressing, we can be the voice of agri-food operators through regulatory bodies, inspection bodies, and government. We feel that as an outside partner, we can do it better than the municipality is doing it on its own. In fact, Prescott Russell got that idea 10 years ago where they outsourced their development of the agri-food and agritourism sector. Because one is, we can do it better as a region than doing it alone. You're already talking about COVID response as a region. We do air transportation as a region. We do healthcare and land ambulance and a number of things as a region. Because partnering is more effective and less costly. By outsourcing an activity like this, it lowers your labor costs. We can also leverage volunteers and stakeholders in the community, so the operators themselves and the consumers and the volunteers to work together with paid staff to get the job done. We can cover the full extent of the value chain, consumers, retailers, restaurants, processors, and farmers. And we can get those folks off the highway that are coming from far away. And my last slide, our budget proposes an annual funding of $150,000. Already, Prescott Russell has a 3-year program in place starting in 2020 at $40,000 per year. They're already committed. That's the core funding we have for the moment to serve the entire region, which is not very much. Last month, I made a similar presentation to the United Counties of SDNG and proposed $25,000 annually. I'm here today presenting to you an opportunity for $35,000 annually. And finally, the last $50,000 coming from members, our sponsors, and various stakeholders and other activity revenues. Of course, you're going to ask a couple of questions. Where is the accountability? How are you going to know that you're going to get value for dollar? For one, the Eastern Ontario Agri-Food Network has 10 years of reputation to back up our proposal to you. More importantly, we have just recently changed our bylaws to create 4 seats on the board of directors for the 4 municipalities, PR, SDNG, Cornwall, Akwesasne. And I've been communicating with your CAO, inviting the City of Cornwall to appoint a municipal councillor, a community leader, or a senior administrator to the board of directors of the network to help us with compliance, reporting, accountability, and strategies. Not to do the heavy lifting, that's where I come in as executive director and volunteer and eventual paid staff to do that. There are grant opportunities out there. Ottawa Tourism, Canada Summer Jobs, we've made an application to OMAFRA, more funding is available out there, but we do need the core funding from our municipal partners as matching funds to do those things and to keep the lights on and to keep the sustained effort to develop local food for the benefit of our local economy, our consumers, and our farmers. I'll accept any questions, please.
Merci, Mr. Manley. Any questions? We'll start with Councillor Hollingsworth, then Councillor Bergeron and Towndale.
Thank you, Your Worship. Thank you, Mr. Manley, for the presentation. I just have one question with regards to the funding. Recognizing that SDNG, population of SDNG is actually probably greater than the City of Cornwall, and keeping in mind that certainly I think we can agree that there are far more agricultural operators in SDNG than there would be located in the City of Cornwall proper. Why wouldn't you ask for the same amount of funding from SDNG as you would from Cornwall? Because if I'm not mistaken, on page 21 of our agenda, the EOAN funding slide, you make note that 25,000 from SDNG and 35,000 from Cornwall. Why wouldn't you ask for the same amount of money from both, I guess, I won't know if the word is municipalities, but from same regions? Why wouldn't we be the same?
Mr. Manley?
That is a fair question, and that is definitely not cast in stone. And I invite your mayors and the CAOs to have a conversation to come up with a regional strategy and to agree upon that. This is the number as we put on paper at this stage. It was largely motivated very arbitrarily by myself, taking a half-educated estimate of 1, capacity to pay. Secondly, recognizing that our effort is not just farmers, it's the whole value chain. And we do recognize that in and around the City of Cornwall, there's a large concentration of other food operators, processors, input providers, restaurants, hotels, and the consumers. Therefore, a significant economic impact is actually happening in Cornwall. Also consider that the farmers that will be benefiting that live outside of SNG also do a lot of their shopping and restaurants in Cornwall. So one way or another, Cornwall is a significant beneficiary. That being said, have a conversation between CEOs and come up to an agreement. I'm all open to that.
Fair enough. That being said, Your Worship, I could support certainly a dialogue. I think this is an excellent idea, but I personally would like to see more of a 50-50 funding sharing formula. I'm going on record for that, but I guess we'll wait and see how negotiations work. And I'm interested to hear what my colleagues have to say. Thank you again, Your Worship. Thank you, Mr. Manley.
Pleasure.
Councillor Bergeron and then Councillors Towndale and McDonald. Councillor Bergeron.
Thank you, Madam Mayor. This definitely is something that I fully support. So I would move the motion when it's time to make a recommendation. Mr. Manley, I do have a question about the shared inspected kitchens as a challenge in our region. I do know quite a few companies that have to drive to Smiths Falls to process food that are kind of, you know, behind the ability here. It's just not allowed in this region. To me, that's just a decision of the health unit. There are places in the province doing this. Can you maybe speak to that as how that's a challenge and how this network would go about helping solve the problem?
Thank you very much. That's a very good question. I, as a food operator myself, I have studied the provincial food regulations. Those regulations are very broad and very loosely worded and not terribly specific. And therefore, as a food operator myself, looking for a shared kitchen or looking for a kitchen situation, when I talk to our local health unit, I get certain answers that are in fact different from other health units across the province. There's an inconsistent application of the same regulation, although they all say they're applying a regulation. That being said, one of the accomplishments of the Food and Agriculture Advisory Council was in fact the bringing together of stakeholders in that sector and speaking on behalf of agri-food operators with one voice to the Eastern Ontario Health Unit, find the right person to talk to with the right leverage and the right message. And Dr. Paul and company have opened up to the idea. Just before COVID broke, we were in the process of implementing a pilot project whereby at least 3 kitchens in the region, 2 in Glengarry and 1 in Cornwall, were going to be operated as a shared multi-user kitchen under the pilot project with the health unit. Sadly, COVID hit in February and March, and the project was put aside because of another obvious priority. But we do hope in the coming year to put this back on the table, and it'll be my job as executive director to have those discussions and press that point home in working with the various stakeholders.
Thank you. I was one of those councillors asking that question when it came to council last year. You know, I do think our region is becoming a bit of an ag tech hub. I definitely like that you are looking to support regional food distribution. I think that's actually a big problem for a lot of big small food growers. So let me just move the recommendation if I can, Madam Mayor. I would also suggest when you are looking for a board seat, I would love to throw my name in there.
We'll get back
to you. We have a meeting on Wednesday.
We'll get back to you, Councillor Bergeron, and I'll look to you when we end the cycle of questions. Councillor Towndale and then Councillor McDonald.
Thank you, Madam Mayor. Actually, Councillor Hollingsworth asked the question I intended to ask based on the proposed funding levels in this document, because it's true SDG does have a larger population and the larger share of agricultural businesses, so it only would seem fair if we could come to a closer dollar amount in that respect. That's just my take on it. But otherwise, you know, it seems like a good idea. Mr. Manley, thank you for the presentation, and I look forward to where this goes in the future. Thank you.
Thank you.
Councillor McDonald.
Thank you, Madam Mayor. And thank you, Tom, for your presentation. I enjoyed it very much, found it very informative. And it just strikes me that at this particular time, given COVID's effect on our communities, that any issue touching on our capacity in any essential, but just what's more essential than food, should certainly get a positive response, because we've experienced shortages you know, in things that we haven't before, I'd say. So it seems to me that if you're out to strengthen the food and agriculture sector, certainly there's buy-in from us, I would hope, because it's a question of our regional capacity, and we have to bolster it any way we can. But I've got a couple of questions, and they have to do with the staffing, because you're going to set up an administration, obviously, and I think you mentioned yourself as a volunteer now, but at one time might become a paid administrator. Could you just run through for me how large you think this administrative network is going to be? And do I read it right that you are looking at an administrative network to be established?
Yes, thank you. With funding annually from Prescott Russell, the network has usually had a coordinator over the years, each year, in fact. Currently, I'm the executive director. I do receive some pay from the network for some part-time duties in that respect. I do contribute some volunteer hours in addition to get the job done. But yes, with appropriate funding, we imagine a staff of 3, executive director, general administrator, overseer, coordinator, and then 2 service providers, program providers, engaged in things such as supporting farmers markets, doing training and providing organizing training with expert training providers, coordinating farm tours, festivals, organizing caterers for such festivals, providing various expertise to the operators, whether it be labels or technical advice, connecting people, organizing social events at the sites of food operators for networking purposes. So yes, I do imagine a staff of about 3 people, largely working from home. We don't expect full-time offices anywhere. We want to keep our overhead very low.
Thank you. I wish you luck. Sounds good to me.
Thank you. Any further comments or questions? Yes, Councillor DePel and then Councillor Gardner.
Thank you, Madam Mayor. I just want to say that I, as well, fully support this. And my question that I did have was, Councillor Elaine McDonald answered that. I was just looking at what we would be looking for, or what the group would be looking for is staffing. So thanks, Councillor McDonald, for asking the question. And thanks for your presentation, Mr. Manley. It was very informative.
Thank you.
Councillor Gardner. Oh, Councillor Gardner, you muted yourself.
Mute.
There we go.
Hi, okay. Tom, during our outside agencies deliberations, we were only allowed to give you $10,000 based on the policies that we have. I'm going to support this, but one of the questions I had at the outside agencies was have the dollars been awarded by the counties? Has Akwesasne contributed? Has the Ottawa Tourism Fund been awarded? Are those 3 people, have they put their money forward already?
At this stage, the one we do have in place is Prescott Russell, $40,000 a year since last year for 3 years. SDNG, I presented, just like I'm doing to you, I presented to SDNG Council just last month, just before Christmas. They are in the
years at 35. Madam Mayor, if I can get Tracy to answer that question, whether or not will come up at every budget meeting.
I will, of course, refer to Ms. Bailey, but I just want to say this is a recommendation to request a report. So we're not making a decision tonight. We're actually recommending that this be referred to a report. And so we will get further information back. But of course, Ms. Bailey is on screen. Go ahead, Ms. Bailey.
Thank you, Madam Mayor. What we would do is, following the decision of the report, if it was approved, we would include it with the budget, and it would come forward with each following budget year already included, but at council's discretion, whether to keep that funding there.
Thank you very much, Tracy. And Tom, nice to see you again.
Likewise, thank you.
Any other questions from council? Councillor Mack.
Glad you recognize me. Okay.
I can see you.
Tom, I was interested in hearing that you based your formula on our capacity to pay. I'll invite you to come back at budget time. You might change your mind on that one. Um, I thought Councillor Gardner mentioned that we had given you $10,000 through the outside agencies. Did I hear that right? No?
I'll clarify. Back in the fall, when I was working with economic development staff at the City of Cornwall, trying to get this subject on to your attention, get your attention on the subject, get it on the agenda, I was instructed at that time to use the community development fund procedure that you have, whereby you award grants up to $10,000 to community agencies. And so I did make an application in that process, knowing very well that I was trying to fit a round peg into a square hole. And I raised the flag with staff at the time. This is weird. I'll do it anyways. I'll just get it on the documents. And we did that. But I quickly followed up with a meeting with the mayor and Caroline to say, I'm hitting the subject with both angles. We did make the application, and I'm coming to council. So now it's up to the City of Cornwall within your process to figure out how you want to do this. But no, $10,000 has not been approved, has not been funded. There have been over the years sporadic, occasional funding for project-specific events with economic development, various partnerships such as the Eastern Ontario local food conference that happened a couple of years ago. But for core funding is not yet established, and no $10,000 have not been awarded.
Okay. Jog my memory, either Councillor Gardner or Councillor Hollingsworth, I believe you're on that committee, the outside agencies. What's the maximum somebody can ask for?
Yeah, so that's Ms. Bailey can answer that.
Okay. Tracy?
She's coming.
I'm coming. Thank you, Madam Mayor. Yes, actually the application went through program 2 that is a maximum amount of $30,000, but the committee did not feel that it fit within the parameters of the program. And so the application was denied, and then the information was provided to the CAO's office in order to make that communication to the agency.
Here's the problem I see with this is that I think we discussed this when we were forming the committee, that if somebody gets turned down at the outside agency level, they come back to council and do the end run. To me, this is an outside agency issue.
Ms. Bailey, did you want to respond?
Actually, maybe Councillor Hollingsworth would, based on the discussion of the committee members.
Councillor Hollingsworth.
I think one of the things that we might want to note, Your Worship, and Councillor McIntosh was with us, there was always potentially a risk that certain groups would kind of fall between policies. The policy for outside agencies has a certain set of criteria. Council has other criteria in terms of MOEs. I think that it's conceivable that this particular proposal may fall more into the MOE kind of category rather than kind of the grants committee sort of parameters. And so I'm not convinced, I'm not suggesting, for example, or for a second that there's kind of an end to run. I think it's more that what Mr. Manley is requesting doesn't fall into the parameters of the outside agencies funding kind of criteria. And we have other MOEs with other organizations, Altsville Hall, for example. We've worked with them in the past. We have a financial arrangement with the River Institute, for example. And I kind of, just my own opinion here, but I see this as potentially kind of following that sort of trajectory as opposed to the grants committee. So I'm not sure how council and ultimately admin want to handle it, but I think the committee felt that it doesn't fit within that policy, and that as soon as, the whole point of creating a policy is to try and streamline things a little bit. So as far as this proposal, I think it potentially falls more into an MOE type category and not so much in the grants committee category. And I think, and my colleagues can kind of agree or disagree with me on this one, I think the committee as a whole felt that it just didn't fit and therefore refused the funding.
Okay, that's what I want to know, why you turned them down. accept it. To me, this is a budget item. Should be sent over to budget when we discuss budget February 1st, 2nd, 3rd. With a report from administration.
Thank you. Any further comments or questions from council? Councillor Bennett.
Thank you, Madam Mayor. Thank you for this presentation, Mr. Manley. It was only 10 slides, but there was a lot of information in there. You would think I'd be a little bit more educated on this sector considering what I do for a living, but I need a little bit more education. And that's why I'm going to support this this request for a report. In that report, I would really like that the funding levels from each municipality be looked at. Knowing as little as I know about how the surrounding areas work within this sector, it just looks odd on paper that we would be paying more than SD&G. But I just will look forward to the report to better educate myself. Thank you.
Any further comments? Before letting you go, Mr. Manley, I'd like to just confirm that Mr. Manley did approach me to give me advance notice as to fitting a square peg into the wrong, the wrong sort of hole for proper process. And I appreciated getting advance notice. And there was a discussion about bringing it here. As Councillor Hollingsworth said, this is not an unusual process. When things don't fit into that grants process, then this is the route to take, and you have done that. And when Mr. Manley gave me that advance notice, he reminded me of an event that took place in South Glengarry at a cidery. It was very exciting. The three counties sort of had come together. There was presence from Akwesasne as well. And you could sense the excitement around the possibilities. And we talked about Peck, Prince Edward County. Everybody knows Peck. And my comments were that we could certainly be every bit as sparkling as Prince Edward County, that we have all of the right ingredients to develop agritourism, agri-tech, as Councillor Bergeron suggested, agribusiness, and that Cornwall is very much a partner with SDG Prescott Russell in that. And so the possibilities are there. And listening to you today, Mr. Manley, these slides certainly suggest that there's a lot of work that can be done to move us in that direction. We've got all the right ingredients. We need just some support and some buy-in and investment. So I appreciate you coming to our council and talking to us. Of course, now you understand the process is that there will be a recommendation and probably a report from administration. You heard from council, there are certain pieces of information they'd like to see fleshed out, so you will take that into consideration as well. Councillor Bergeron, did you want to make any further comment?
Only comment would be that the report doesn't have a date. I agree with Councillor McIntosh. I'd love to talk about this at budget in the sum of all things so we can prioritize. I don't know if that's possible, so I'll ask the question, I suppose.
Yes, Madam Cieo. Can you comment as to potential timeline for a report?
So I think we can, we might be able to get a report back at the next council meeting. And if for some reason we're not able to, we can have a report that comes back during the budget process.
Councillor Bergeron, did you want to go further now?
Yeah, I would move the recommendation. I would like the report at budget, not at the next council meeting.
Is there a seconder for that motion? Councillor Mack. All right, any further discussion or debate? All in favor? Against? Carried. There may be some internet connection trouble. Mr. Manley, thank you very much for your presentation. We appreciate your coming to our Zoom council meeting. Merci.
Thank you very much for the invitation. I look forward to working with you.
Madam Clerk.
Our consent items. The first item is recommending that the Heart of the City applications be approved as followed. The council approved the following items: Robert and Michelle Cheeseborough at 117-119 Montreal Road, Williamstown Mini Storage, Inc. at 113.5 Pitt Street, and Rothmar Holdings, Inc. at 1216 2nd Street West. RFP 20P17, Electronic Patient Care, recommended that this RFP be awarded to Prehose Incorporated from Quebec City at the total bid price of $376,137.45 for a term of 5 years with the option to renew for 3 additional one-year terms. The other items have been moved to communications, Madam Mayor.
So we need a motion to adopt those consent items still on in consent. Councillor Grant, seconded by Councillor Gardner. Any discussion? All in favor? Carried. Next item.
Our next item on the agenda is the resolution for Belfort, and I understand that the consent item and bylaw have been moved. Shall I proceed with the resolutions just the same?
Madam CAO, do you want to have a comment there?
I think, Madam Mayor, what we should do is we should move, we should look at the resolution when we're looking at the report on communications.
Thank you. So
Then
the next item, Madam Clerk.
Moving on to reports from unfinished business, we have 1 2nd Street West at Riverdale Terrace with the recommendation that Council direct administration to undertake the necessary data collection and analysis in the spring of 2021, and that administration bring a report back to Council summarizing the findings of the traffic analysis, complete with recommendations.
Madam CAO, can you comment on that or just give some introductory or summary comments?
Certainly, thank you, Madam Mayor. So I think that there's been a lot of different activity that's gone on in the last year and a half in this location. There's been construction, but then there's also been the pandemic that has hit. So administration's recommendation is to take the time to do a proper study of the activity in the area, and we're planning to do that in the spring and then come back to Council with a report. We have on the meeting this evening, we have Mr. Bill DeWitt that could also answer some questions if Council has any questions.
And there's Mr. DeWitt. So Council, do you have any questions? Councillor Towndale and then Councillor Mack.
Thank you, Madam Mayor. Well, I look forward to the report, but I mean, the way 2021 is going, I think, you know, we're going to see similar traffic patterns than we did in 2020, if not less. So I don't know if it'll honestly give an accurate picture. But, you know, the original reason this came forward was because the petition was put together predominantly featuring the residents from Riverdale Terrace because of the location of that particular residence. And now there's a second wing there that's been built since this petition was originally submitted to Council at the beginning of last year. And the third wing is under construction. In addition, as we know, there's a restaurant there, there's an ice cream parlor, there's a convenience store. The original petition had about 350 signatures. The majority were from Cornwall, some were from the counties, so it wasn't too dispersed. And there were letters of support included from the principal of Viscount Alexander, MP Guy Lozon, the Trophy Shop, and Shortline Convenience, the owners of those respective businesses. So, I mean, you know, that wasn't included in this report because the petition, or this, well, it's not the report yet, but this this part to Council, it was there last year in the agenda. I just wanted to highlight that before we go forward. But, you know, we did receive this petition about a year ago. I understand COVID slowed things down, but I think, you know, when it comes down to it, this is something that we have to do. If you drive through that area, especially in the summer, there's people crossing the street all the time in that area. And it gets difficult to go through, especially with cars parked on either side of the road, whatnot. I realize it might be a little busier now because of construction going on and whatnot, but it's a busy area and there's pedestrians, and a lot of them happen to be the residents of Riverdale Terrace. Some of them don't have the best mobility, so it does take them a little longer to cross. So I think this is something that would help them, and I would say it's almost similar to the one that we put on Water Street. I realize that is a 4-lane road, but we put it there next to the seniors' residence to get to the park. Whereas, this is kind of the same idea to, between the convenience store and the ice cream store and then the 2 schools in Riverdale. So I just want to highlight all that. I think we'll really debate this when the report comes back, but I hope we get it in a timely fashion. Thank you.
Councillor Mack and then Councillor Grant. Councillor Mack. You have to unmute. That didn't work.
Hey, now you got it.
Yes, thank you.
I'm a frequent user of that road because where I live, and I don't know, I don't see that much pedestrian traffic there. Maybe I'm going at different times than Justin is. But, my first thought was when they talked about the crosswalk was why would you need a crosswalk there? I realized an ice cream shop across the road, and I believe residents in the past, I believe even a staff member has escorted people over to get the ice cream and bring it back. Why a convenience store on the same side down the road is feels to be needs to be a crosswalk. I don't know, but they're expensive. Logistically, it's going to be interesting where you put that crosswalk. You've got a bus stop there. You've got driveways. It's very unusual. I would think the engineering department would come back and say that it's not be the best location for a crosswalk. I'll leave it at that. I'll be interested in seeing the report from traffic. Comes back, but Justin does bring up a good point. There is another development going up on that side, and that could change the traffic, pedestrian traffic. But I'll wait for the report. But I know the one in Water Street. All the years I've been traveling, seeing one person use it. So we'll see.
Councillor Grant.
Thank you, Madam Mayor. I got lobbied quite a bit on this particular crosswalk from a few residents I greeted at church, and a few of them climbed up and down my side one day. But anyway, what I'm concerned there is the speed of the traffic that the cars that go along there. I know Councillor McIntosh has said this before, trying to get out from the street he lives on, Prescott, onto 2nd Street is very difficult. So I imagine if you're trying to walk across there, it would be really difficult. But I'd like to see the report, do the traffic counts, and I'd really like them to do an average speed along that section as well. I think it is hazardous, and if there is that much pedestrian activity, then I believe that it warrants it, but I'd like to get that information before I make an educated decision.
Councillor Gardner.
Okay, no?
Yes, go ahead.
Okay. Just to add to the discussion, my understanding is the building that's going up on the north side, the new one that's going up now, many of those residents will cross the 2nd Street in order to go and eat at their dining room in the established building. So that'll create a lot of traffic going across the street. And I agree with the speed. The speed, I've gone for ice cream there, and I've seen motorcycles fly through there, cars with their mufflers blaring and racing. So yeah, I'll support it when it comes around, because I've been lobbied just like Glenn, but it wasn't up one side to the other, it was on my back. So.
Councillor Bergeron.
Thank you, Madam Mayor. I kind of echo some of the comments. My question is for, I believe, Mr. DeWitt. Can we get a few examples of why this wouldn't have been done because of COVID? It seems to me like a traffic analysis. As Councillor Towndale was pointing out, this has been going on for a while. I would have expected some sort of engineering or data to have been collected already. I just don't really understand how COVID would be getting in the way of that.
Mr. DeWitt.
Through you, Madam Mayor. It's my understanding that we've not been able to do the project because of the COVID, because of the pandemic. because of the pandemic, the traffic patterns and pedestrian patterns have been changed, if you will, and they're not representative of what what would happen under sort of normal circumstances. So that's all I can give you at this point in time.
Okay, I can appreciate it. But to Councillor Towndale's point, I think it's necessary to get this done right now, regardless of what's happening in 2021. This is data and engineering and a report that I think we can make some pretty educated decisions on with the data we do have. Thank you.
Any further comments? Councillor McDonald?
I think, thank you, Madam Mayor. And I think given the different phases of the building in Riverdale Terrace, this is a report we might be calling for an updating of for, maybe every 6 months or so after we get the initial one. But I'm curious to know if the type of crosswalk being planned, is it one such as we have between 15 Edward Street crossing Montreal Road, or there's been reference to one on Water Street? Do you mean lights in front of, close to York there?
Mr. DeWitt.
Through you, Madam Mayor, it's my understanding that yes, it would look something like the one in York Street. I know that the one on Edward Street, I think the way it works is that it simply it triggers the stoplight there,
yeah,
which in my opinion is safer, but it's just much more expensive.
Is it? Okay. Thank you.
Any further comments? I would like to add that in addition to the comments from Councillors Bergeron and Towndale, that I just want to say the business of this city continues. It does. We will continue to receive petitions. We want to. We will continue to run the business of this city. But the pandemic is not just some easy excuse that we're throwing out there. I just want to remind people that administration has not been sitting idly by during this process, not at all. And we're not always in agreement with how things are done, and I understand them. But nobody has been sitting still during this process. And we have endeavored to continue with all city business as much as possible. And we want and welcome petitions like this, and we'll continue to work on these issues. Is there a motion? Councillor Grant, seconded by Councillor Ibaya. Any further discussion? All in favor? Carried. Thank you, Mr. DeWitt. Madam Clerk, has Dr. Paul indicated that he'll be available soon?
I have not received word for him. I continue to be on the lookout for his wanting to join our meeting.
Okay. I think the next item on the agenda is the parking report.
It is?
So maybe before we dive into that one, because that one will probably also bring about a good discussion from council, maybe I'd like to have the CAO provide us with a COVID-19 update at this point. There was a meeting on Saturday that may be of interest to the community, and I'd like Madam CAO to maybe bring us up to date.
Thank you, Madam Mayor. I'm just going to grab my notes. Stephen Golden and I were able to participate in a meeting late Saturday afternoon that was chaired by the retired General Rick Hillier. And it was really about vaccine rollout and long-term care. Oh, there's Dr. Paul. So the update from the call, the Premier was on the call, by the way, and he announced that it's his goal to have all of the long-term cares vaccinated in the hot zones by January the 21st. And Rick Hillier had indicated that he's hoping to be able to have it completed by January the 18th. Rick Hillier went on to say that the goal is to have all long-term care homes in Ontario have their first vaccine by February the 15th. The vaccines being deployed starting this week to other regions. We know that there is vaccine coming to Cornwall, to the Eastern Ontario Health Unit area, likely tomorrow. And we know that there are a couple of homes that will be hoping to receive vaccine on Wednesday. And that will be done in conjunction with our paramedic services and the health unit. They wanted to encourage the messaging that the vaccine is certainly safe, and they want everybody to have the vaccine. They want everyone else to really kind of inspire everyone, I think was the word that they used to get the vaccine. They also encouraged more and more testing locally in our long-term care areas. So continue with the testing, rapid testing where that's available. And but we know the vaccine's coming this week. I'm sure Dr. Paul is going to provide an update to everyone, but those are some of the high-level comments that came from the call on Saturday.
Thank you, Madam CAO. I'd like to welcome Dr. Paul to our meeting. So Dr. Paul, this is our first council meeting that is entirely through Zoom. Some councillors have been operating with Zoom in a sort of a hybrid model, and now this is entirely through Zoom because of the spike in cases in Cornwall in particular. Mm-hmm. The reason that you have been invited to this meeting is because I think you are going to be releasing some information. You may already have done so through the media at 4:15, mm-hmm. But certainly this meeting is being carried by your TV and streamed on YouTube. So we are, again, trying to reach as many people as possible with the message from the health unit, and also bring questions through council that we've been hearing in our community. So, bienvenue à notre réunion du conseil. Welcome, Dr. Paul. Will Dr. Paul be able to share his screen, Madam Clerk, if that's possible?
I'm going to try to make Dr. Paul a co-host.
Dr. Paul, I imagine you'll want to
yes.
share information.
Yes, yes.
Okay, Dr. Paul is now a co-host.
Oh, great. Thank you very much. Merci, Madame Clement. Thank you very much. And just to correct, I actually invited myself to this meeting. I sent a memo yesterday on Sunday to everybody, to all 17 municipalities. I just did North Glengarry, and I'm going to do all of them because I think it's important for me to answer all the questions from all our municipalities. And so I'm glad it coincided with you had one today. So
well, we would have had you anyway, Dr. Paul, whether it's a special council meeting or this council meeting. So please go ahead.
No, it's my great pleasure to do this. And like I said, one of the things that I wanted to cover is to give you an overview of where we are with COVID and the cases, and then which is a bit of a good news, bad news. You know, I think that there are, we have increased cases, and we're seeing those across the province, not only us. But I also ended up on a positive note with a vaccine. So I I kind of designed it this way. So permit me to share my screen so I could just go over. No, actually, I'm not allowed to share my screen. So I haven't been given options to do that.
1 minute, Dr. Paul.
Yeah.
Sorry about that. Madam Clerk.
Oh, yeah, I'm good. I'm fine.
Got it?
Yeah, I got it. Thank you. I don't know what that is. There we go. So I just want to, you're good? You can see my screen?
Yes, thank you.
So I just wanted to, again, go over some of the numbers and sort of then hone in on Cornwall, but I just wanted to give you an overall picture. As you know, I want to start sort of prefacing by saying that Ontario has been having a record number of cases. Today's numbers were 3,338 as compared to the previous day. Most of them driven by Toronto, but we're seeing numbers and health units going into red and gray across the province, including us as well. And obviously, one of the things that we're going to be looking at is like what's going on and what will be done about it. And there will be an announcement likely tomorrow by the Premier, looking at a whole slew of possible things ranging from curfew to more restrictions and so on. So we'll see what they're going to decide. But certainly it's because our hospital systems, particularly in Toronto, and the bigger cities are being overwhelmed. We're starting to see it at this pace. It seems that ICU capacity would be reach its limit in February, and so those are a lot of reasons that we're doing this. Obviously, in terms of worrying about the numbers, our local numbers have been persistently going up. Now it's been about a month and a half, really alarmingly. We're now at 695 active cases, and we're almost at 2,000 cases fully. We have 18 patients hospitalized and 5 in the ICU, most of which are at the Cornwall Hospital, which, by the way, is at capacity, has 187 patients and 160 capacity, and they're really our regional COVID regional hospital. I speak with Jeanette almost daily just to see where they're at with that, and so we had a couple of other deaths we've added. Unfortunately, two more came from Akwesasne. We have an outbreak in Akwesasne at the long-term care home there, which is tragic. We have 14 outbreaks at this point, 5 of which are in Cornwall, including Glenstore Dunn Lodge. That seems to be stable. But out of the 14 outbreaks, just to give you context, out of the 14 outbreaks that we have, and most of them are in long-term care retirement home, one of the things that I'm seeing a pattern is that only a few, including Glenstore and just Lancaster, and I think one more, have positive residents. The other ones are positive staff. Because we do the routine testing and they come back positive, which means it's a reflection of what's outside going in. So fortunately, in a lot of them, we're able to either prevent any residents from developing or minimizing the spread. And that's the whole point of declaring an outbreak. So at least we have that as a silver lining, but I'm not happy about that because that tells you increased level of infection in the community. So I'm just going to talk about this past weekend. Over the last 2 days, we actually added 166 cases to our caseload, including 21 from Akwesasne, 71 from Cornwall over the weekend, 39 from SDNG, and 35 from Prescott Russell. And I can tell you that I will go into a bit more details later, but out of these 71, there were 4 related to 1 or 2 cases in workplaces. The remainder were close contacts of people, household, or documented close contacts of somebody who was positive. And so I wanted to look at that and sort of look at the trends. In terms of the map, obviously, just to kind of show you, obviously right now, Cornwall has by far surpassed has the highest number of cases and highest number of active cases at this point, as you can see. But other areas still have significant active cases as well, in particular Prescott Russell. But now, like I said, we're seeing an uptick in the Cornwall area. If we look at just sort of the case summaries, I was actually talking with the North Glengarry, and I was showing him, these trajectories, and you can see that, since the beginning of it, we were quite low. I mean, and we're talking about Cornwall now specifically, and boom, all of a sudden, come November, we spiked up. We were, I think 40 or something, in June, very low, and all of a sudden we're up here. And it's a pattern that we see across the health unit as well, and it's a pattern that we see around us. And the reason I sort of talk about that is because this virus spreads. Like all of a sudden it was in Europe, that new variant, and now it's here. So it spreads. If it can spread from UK to here, it'll spread from Cornwall to SDNG or to vice versa. So in any case, the Cornwall numbers are quite high in this regard. One of the things that we also look at is what we call the rolling average. And the rolling average is this document here, which is number of cases per 7 days per 100,000 people. And just to give you context, these three lines over here, the green, the orange, and the yellow, are the zones. So if you're kind of below the yellow here, your yellow zone. If your orange zone is here, and then red zone is 40 and above, and obviously gray zone is higher. Now you could see that right now Cornwall is at the top of the list. It's very high in terms of 7-day per 100,000, and our average in EOHU was 138. Now this is again, a picture in time, and we'll see how it goes. I'm hoping that we kind of see a downward trend in this, and this reflects a lot of Christmas and get-togethers here.
We're not in the downward trend yet, though, eh?
No. I just you see this slightly. I'd like to see it go down a bit more, but certainly over just between here, like December 26th or so, up until here, it was certainly upwards. It's kind of flattened. That's what we're saying. But that's a day-to-day, so we have to see it, how we're going. But the others have seemed to have flattened as well. The orange dark one is our health unit in general. The gray one is SDNG, and the orange one, this one down here is where is it? Prescott. Anyway, sorry, SDNG, Prescott Russell, EOHU. However, wherever we land, we're still way above red. Like we're still, this is sort of gray territory here. And so if you take that into account with some of our other numbers that I'll share with you, we're clearly collectively in higher than red zone. Let's put it this way. And you get a clear difference. So we're seeing this progression, and we're not, obviously, we're not encouraged by this. But again, this is something that we're seeing across the province, and others have even higher numbers than we do, Windsor and so on. But again, our context, our local context, is this reality here, and I'm hoping that maybe we see the downtick a bit, because this is kind of around the 10th, 11th is really when we would see kind of you would see a flattening if there's any effect of the the 2-week kind of quarantine and lockdown that we had. So I'm hoping that we can see that flatten and move forward, but only time will tell. I must tell you that when we have cases like this, like for example over the weekend, having to follow up on 166 cases is a lot. It's a lot of work, a lot of contact tracing. Each of our contact tracing nurses and staff sometimes have to call 7-8 contacts, And one of what we're seeing in mobility data is that people are moving. They're moving far from their home, and they're intermingling. And that's what we're seeing both across the province and across Canada as well. So that's where we are with those numbers. The case summaries and so on are there. I just want to share with you some more data as well, and then we'll break it down to some other data that I want to share with you that's more specific to Cornwall. So this is just sort of an overall, we'll call the epidemic curve, which just shows you again the trajectory of the numbers of the health unit in terms of going upwards. This is the R effective. This is the reproductive number, which is basically the number of people that one person can infect, and you want to keep it under 1. So, for example, if you have a 1.5, it means that one person can infect 1.5 people, but 10 people will infect 15. And 15 will infect much more. So we want to keep it under 1. And
the right slide on the screen. We're still on the 71, 21, 166 page.
How come it didn't show? Oh, you know what? Hold on. Sorry. It's a new share. It's a different one. Sorry about that. You got it now?
Now, yes.
Oh, okay. Sorry. Yeah. It's somehow you have to tell it what you want to share on the screen. Okay. So this is just this was the first slide that I showed was just the epi curve that we call, which is essentially the just the number of cases, daily cases. The next one, is the reproductive number, and you could see that we want to keep it below 1. And clearly, you know, we're above it. We were at 1.5 for last week. Now we're down to about 1.36. But again, you want to keep it under 1. And again, that is another factor when you're talking about if you're going to be red zone, yellow zone, or orange zone. You're looking at your rolling average that I talked to you about. You're looking at your at this number, and when at these levels you're red, you're going to red zone, if not higher. And then this one here is an interesting one. This is the one in terms of acquisition from in the health unit, and we're going to go more granular with this. But just to show you, this is the Public Health Ontario that publishes this for each health unit, and this shows you. This dark green indicates the proportion of individuals that have had close contact. We know they had close contact with somebody, you know, be it at home, be it at work, be it whatever, but somebody who has been in contact with somebody who eventually developed COVID or had COVID. You can actually see as well that we have the light blue here, which represents outbreak numbers again, and that's we know where they're coming from. The orange ones are where we don't have a known epilink, which is low, which is good because the less of these you have, the more you're confident that you don't have it like all over the place. You know, it's an indication of presence in the community or spread in the community. And if you look at sort of the purple one, the purple number here is travel related, and you could see that it's lower now. But you could kind of compare it to initially when we started in the spring, where the travel numbers were, you know, relatively higher. And just out of context, I just want to explain, this is the Ontario overall number. This is the Ontario. And again, the light green blue here, this in the middle, is close contacts. And you could see that it's been kind of steady. You can see that was kind of equal here, but then all of a sudden you get this gray zone here, which is missing information. And that's actually similar to what Toronto is seeing right now, because they have so many cases, they're not able to do all the contact tracing, and they're not able to ascertain where they got it from. And that's the danger of having so many cases and being overwhelmed. As you see, in contrast to us, we don't have many gray zones here. We're not missing a lot. I just wanted to point that out. And so again, you could see kind of the Ontario picture was more travel driven in the beginning, and then we've got, like I said, this sort of not shift, but almost a constant kind of majority of cases being close contacts. This is another number. This is basically positivity, percent positivity. And again, these are indices, these are part of the indicators that tell us you're going to go from, you know, yellow to green to orange to red or green or whatever. And so these are these green bars here are the number of tests that are done in our area, and per 100,000. And then you have your positivity, and you could see that, you know, we were kind of down. This is around 2% here, but we're around 1% here. And then we went up to 2, went back down to a little bit less than 2. And then all of a sudden, boom, we shot up to 5.2%, you know, higher over here around December 27th and moving forward. And interestingly, and that again puts us above red, you know, that percentage of positivity. However, if you look at it progressive in terms of comparing other provinces, other parts of the province, you can actually see that the overall is 7%. So we're lower than that, but we're in the top third. I would say the top, you know, 12 or so out of the 34 health units we're here. And you can see that areas, Peel, Toronto, they're in the 13-10% range, which is quite high. So again, that's another one. And the other interesting thing as well here, this just is these various colors are all the different health units, but you can kind of see a progressive increase in the positivity. We're buried here with yellow. It's hard to see. But the next one that's interesting is this one that shows us positivities in all age groups, sort of, you know, here, but you could see that marked increase here in 12 to 13-year-olds, young kids. And this coincides with kids on vacation and so on. So that's one of the reasons we were worried about sending kids back to school, because there's a high rate in those age groups. And so that's one of the things that we wanted to have. And now, so I'm going to start sharing another part of my screen. Let me just, now I'll get it right this time, though. Here we go. And I want to new share, and I want to share this one. So now you could see it. Okay, so this is just fresh. We just did it today, and I'm going to be presenting it in a more robust way to you with a written sort of documentation. It'll be on our website, and it'll be shared with Cornwall with you as well. But just to give you, we have something called CCM, which is our case contact management, which changed in the middle of the summer. Towards the end of the summer, we changed the tracking system. And we use this new one. So our data starts really from August on, and it's a very clunky system. It's a very difficult to put data in and to be able to analyze it. However, what we did is we looked at the cases that we could analyze in terms of, there's two things. There's kind of who they got it from and where they got it from. There's two kind of different things. And the who they got it from, we have more information on. And so or in what setting or where they were. But this one here shows you, this is for the Eastern Ontario Health Unit area, that 61% of these cases were close contact. And from those, you could see that about a quarter were, it's 11%, but it's a swath of this one. But you can kind of see that the workplace and close friend associate. So this is like visiting somebody or going out for a coffee with a friend and those type of things. And this is workplace. And you can see that on their own, they're not that big. This is like 11%, this is 14%, but they make 25% of the total. But then what happens is they go home, and we've seen it time and time again where, one person infects 4 others at home. And we've had families that have had 6, 7, 8 people at home. And so that's what we're seeing. And we're seeing that in the EOHU area. And then we've broken it down. And this is the Prescott Russell, this is SDNG. And then if you go to the Cornwall context, actually most of our cases, if you can see here, 83% of the cases that we had in Cornwall just this period. And this is only until January 5th. We haven't included the other data, but we will build it up as soon as we get the data. You could see here as well that the majority of the cases were close contact, and by far most of those were household contacts. But then we had about I would say between 23% of total cases that were either in a workplace or a close friend or associate visiting somebody and so on without taking the precautions. And then you have those individuals going home and infecting their household contacts, and that's what we're seeing. And so that's the majority, and you could see the trends. It's the same in all 3, although it's a bit higher percentage in Cornwall as the rest of the areas. Now this other one here is just something I'm going to be digging into even more, but just to kind of show you some of the where we have the setting of the community. These are the top 6 settings of the cases, and you could see that most of the settings are in single unit dwellings. Either they visited somebody or they were at home. And again, we're going to flesh this out, but it kind of it shows you as well that we've got gyms out of these cases. We've got gyms, we've got schools, we've got food premises and workplaces. And for the purposes of Cornwall, we went a bit more granular, and we will go a bit more granular. But again, these settings where we identify settings, not people, settings, single unit dwellings, so visiting somebody, food premise, we've had 6 out of these cases, 6 cases. Now, we haven't had outbreaks. That's the other thing. We're lucky. In our area, we haven't had many business outbreaks. Like if you look at what's happening in GTA and in other parts of the province, there's about 150 outbreaks where you've got clusters of cases from businesses, from manufacturing, and so on. But in this situation, when we say 6 cases, they're isolated cases in restaurants, and usually the workers there. Manufacturing, we've had 5 cases. School, 4 cases. Elementary school, 4 cases. Banks, financial institutions, 4 cases. Workplaces is a general one. Multi-unit dwelling, within Ontario. You have all these things here. So we're trying to get more granular, but it gives us an idea of where the settings were. But I want to stress that we have not had outbreaks. But we have seen, like I said, in overall, we had seen sort of, restaurants and gyms overall. We haven't seen gyms in Cornwall, though. If you look at the Cornwall numbers here, it's really more single dwellings, school, not in Cornwall gym. We've had 6 in restaurants. We've had 3 in workplaces. So again, we're going to flush.
Does that include the 71 from this past weekend?
No, it's to the 5th. That's why I was saying. So I'm going to flush this up. And when I have it more, when we put up on the website, probably on Wednesday, we'll have that. But I didn't have that data today. We have to flush it out. So, but the data that we had today, Bernadette, I just have it, says that we've had 4 cases linked to workplaces. Perhaps 1 or 2, there might be outbreaks. We're investigating that because sometimes it's hard to tell. They may be working in the same place, but they never saw each other, and they got it from their cousin at home. So that's what it's difficult for us to do. But we had 4. 1 was traveled to U.S., and the rest of the 71 were close contacts or household contacts. That's what we got. We got that today. I deliberately asked them to give me that information because it wasn't included here. So it's going to change here. But that's what we're seeing. So when we are looking at the data and looking at that, it still is people getting together. It still is people getting together either at workplace or with friends or going out and not taking the proper precautions. What we're also seeing is a tendency that people tend to say, well, I'm feeling well, I'm good. I don't have COVID. And what happens is, and we've had multiple cases where we repeatedly ask them, like, when did you go out? Why did you go with your friend? Yeah, well, you know what? I'm fine. I didn't need to wear a mask when I went to lunch with my colleague. I didn't need to go on I didn't need to wear a mask when we carpooled. And then what happens is invariably one of the 2 gets sick a day later and was contagious 2 days before, and they were not masking and they were not physically distancing. We're seeing that over and over again, and we're seeing people going to people's homes and not masking as well, obviously. And then what happens is they go home and they multiply it. So I call it the multiplier effect. That's what we're seeing. So we're going to get more granular with this, but like I said, it was our first swath. I just wanted to get it out, and then I want to, and that's that. Now I'll go to vaccines, and then I'll open it up to questions. Mm-hmm. So we are, like I said, we are at this point expecting some announcement tomorrow. I don't think it's going to be curfews. I think it's going to be more restrictive, restricting homes, increasing the list of non-essential services, perhaps limiting, what I'm hoping is big box stores limited only to groceries and pharmacies, and limiting 1 household member per shopping spree, because we're seeing all that. Those are little things that we can do. Anything that can decrease that mobility, I think, will help as the next thing. And I suspect those are the type of things they're going to do. Trying also to look at interregional travel, interprovincial travel. I don't think they can touch, but at least the interregional travel. I don't know how they're going to do that, but that's something that we talked about over the weekend, because we had a meeting with the public health measures table to discuss this. Then I'm just going to go back to my other slide, and I will change my new share. So I'm going to go back to this one because I want to talk about vaccines, which is now appropriate because we've talked about sort of bad case numbers, but I also want to talk a bit about and I noticed that when I came in, Maureen was talking about her meeting. I think it was the talk on Saturday. Well, the medical officers of health had a meeting with the general and the minister of health and the premier as well, and we had the same pep talk as well, and we had one on Sunday as well. And on Sunday, they asked us to focus, like Maureen said, on long-term care facilities and retirement homes and healthcare workers, trying to identify some of the very high-risk healthcare workers, which we're doing. And so I'm very happy to report that we will be getting our vaccine sent to us tomorrow, if all goes well. They're not sure because apparently it comes from Belgium and then it stops in several places, then it comes here. So we're just waiting for final delivery. We've got everything ready. We've got people ready to go and pick it up. And what we're going to be doing is with that Pfizer vaccine, we're going to immediately start vaccinating our long-term care facilities. We have been given to February 15th to do it. I think we'll get it done in a week and a half. If you ask me, we have 18 long-term care facilities and we can do them, or we're doing them simultaneously. We're doing Prescott Russell and SDNG at the same time. And so it's just a matter of vaccine supply. We have been told we will be getting one tray of vaccines per week, which is about 1,200 doses. And so we need 1,500 dosages for long-term care residents and about another 2,000 dosages for staff. So we'll be able to get this done. We also have received, we'll be receiving vaccine for Akwesasne, and that'll be delivered to them as well by the end of the week. And they're going to start vaccinating their long-term care. So you can see here. So we're ready to go. We've got our and thank you to your SDNG and the Cornwall, Bill Lister and his team. Thank you very much. Very appreciative. Ready to go. We've got the Cornwall pharmacist that's going to be the Cornwall Hospital pharmacist that's going to be coming and helping him mix it. Because if you mix it properly, you get an extra dose. So we're going to squeeze a 6th dose out of the bottles. And so he's going to be accompanying us, Mohammed from the hospital. It's going to be accompanying Bill and his team going into the homes and vaccinating everybody. That's what we're going to be doing. And we're starting, I think we're starting in Cornwall as soon as we get it. And I'm not sure which one is first, but we have a risk analysis on it. The ministry gave it to us, and we're going to be doing them all. But I do anticipate vaccinating them within a week, done within a week. Because we did all the long-term care testing in less than a week. It's the same kind of approach. So, and then once we do those, we're going to also do the retirement homes. And hopefully we'll get both done by February. Vaccine dose pending, obviously, but we have been guaranteed our vaccine supply through the end of this month, and we're getting our allotment numbers for February in a day now. So we will be getting vaccine. Now this one, I want to go over this with you. This is the General Hillier presented this to us. And I took out some of the details because I just wanted to sort of show you sort of in general the sort of the phases, of what's, and these phases were determined by the National Association, the NACI, which is National Advisory of Immunization in Canada. They give recommendations on vaccines and indications and so on. And so the phase 1, and again, this is, I removed the timelines because I didn't believe the timelines, and I'll tell you why. Because this was only for Pfizer and Moderna. And this doesn't take into account other, like Astra's vaccine that's going to be likely approved shortly, and or the Janssen one. So this is presuming we don't get any other vaccine. So it's trickling in. By the end of this period, they had put here like end of February, March. I believe it's going to be earlier. We'll have done, and I believe it's going to be closer to the end, end of January, middle of February, where we'll have done the congregate living, all of it. We'll have done it. The 2 dosages done. We'll have done the healthcare workers, which we're going to prioritize initially with the hospital, people who are, at the Cornwall Hospital and, which is the, regional COVID hospital, ICU and so on. We're also going to be, like I said, the First Nations is being taken care of, and adult chronic care homes, again, working with Arlene and others to do that. I believe that we can do that. Given vaccine supply, we'll be able to do that very quickly. Again, it depends on how quickly the numbers rev up. They're saying 1.2 million by February. That's excluding other vaccines. So that's why I'm a bit optimistic that the timelines can shift more earlier. But I just wanted to show you the sequencing. So the next one is going to be essential workers, which will include police, fire, we'll have a whole list of people there. And obviously adults, older adults, and at-risk populations. That'll be the next swath. And that's when you see the big numbers, 5 million, 5 million, 5 million. And that's only of the 2 companies. So we will have plenty of vaccine going. What I wanted to show here was if you're looking at the reason it's done in hospital site clinics, congregate living, healthcare workers is because of the nature. So we're going to have to do the hospitals in the hospitals. We're going to have to do the long-term care homes in the long-term care homes, because now we can move Pfizer, so we know how to do it. That it's been done across the province, and we know how to do that. And because once it goes out of the -70, you thaw it. It's good for 5 days at 2 to 8 degrees. The Moderna one I prefer because once you thaw it, it's good for 30 days, and it's easier to transport, and it's at -20 versus -70. So anyway, we have vaccines, we have fridges for both, there's no problem. And like I said, what we're trying to do right now is we're trying to then move it on to the essential workers and the adults in this population, and then a steady state. So around here sometime, and I don't know when it would be, they're saying April, May, I'm saying earlier, when it's going to be available, doctors' offices, it's going to be available in pharmacies, it's going to be available everywhere. And again, it's done in these living sessions. And then moving forward, we're going to be leading, and public health will be leading public health vaccination sites. There'll be mass vaccination for, police or whatever, those groups. And this is where we'll be looking to the city of Cornwall and our other municipal partners to identify your workers, because they're going to be there as well, fire, police, and so on. Paramedics are being done in the first swath, particularly our vaccinators. We're vaccinating them right away, so that paramedics will be done. But, the other essential workers that are not medical, but are, I think, essential. So we'll be looking to you, to work with you and work with the chief and, to organize them. Where does it make more sense to do it? Should we do it at the civic complex and have all the police go? I'm not saying police like that, or, this type of worker. So those are the type of things we'll be talking to you about. Looking at places to vaccinate, certainly. And then when we start doing the adults, we may be doing it simultaneously depending on vaccines. So we may be doing, at the civic complex, maybe doing, all the essential workers, and somewhere else, the elderly. You know what I mean? So those are the type of things those are the type of problems that I'd like to have. If you give me the vaccine, simultaneously, we'll be able to do all of these people simultaneously rather than sequentially. Otherwise, we're going to have to prioritize, and the priority to me is we're going to have to sort of split it between essential workers, prioritize them, and then go the adults as well, because I think the adults are important. The reason the adults, as you know, are more vulnerable, but the majority. So if you're an adult, the older you are, the higher the risk. But the risk is much higher at the same age if you're in a congregate living setting. And that's why we're doing long-term care first. And, unfortunately, out of the 5,000 deaths that we've had, I think over 80% were in congregate setting, in elderly. So anyway, so that's where we are with that. So I believe that by, like I said, March, April, we'll have a bigger bulk of vaccine available, and we'll be rolling it out. But again, probably earlier, if you ask me, because I foresee that we're going to get several vaccines approved over the next couple of weeks, which will add. And the Canadian government has already purchased from the other two as well. So it's just going to add to our numbers. So this is more of a conservative approach. It doesn't take into account the other vaccines, but it gives you an idea of the sequencing, and it gives you an idea of the plan and the logic behind it. So I'm looking forward to this. This is something that I keep calling, we all call it the light at the end of the tunnel, and it really is the bright light. And so we're now kind of the next region that was selected because of our numbers. Actually, we've had, as you know, our numbers are in the gray zone, and they started with some of the high risk areas. They started Toronto, Windsor, and those are high risk areas, but we were next. So I'm delighted that we'll be able to start. Like others have not yet received their vaccine, like Leeds Grenville has not received their vaccine yet. Renfrew has not received vaccine, and they won't for the next week or two. So we're starting, and I think we need to. We have the numbers, we have the vulnerable populations, and we're ready to go. So that's at a positive note I wanted to finish.
Thank you, Dr. Paul. So I'd like to open it up for questions. As Dr. Paul indicated, he will take questions. So I'll start a list. Please keep your hands up. I'm just going to write, and we'll start with Councillor Grant.
Thank you, Madam Mayor. Thank you, Dr. Paul. That was very informative. I'm just curious about freezer. My understanding is that the only freezer in our area is in Hawkesbury. Have we acquired other freezers?
No, that's the one we got it in Hawkesbury because the Hawkesbury Hospital bought it, and at the time there weren't any other available, so we grabbed it. It doesn't mean anything. We're just going to store it there and move it. So to me it's moot. What we do have though is the Moderna freezer, because I believe the Moderna one is going to take over. That's the one easier. We have one in Cornwall. So we have a Moderna one and we have a -71. Between me and you, the -71 is only going to last as long as we don't have the others. It's very clunky. It's very difficult to transport. And so when we have the Moderna one, it will be easier, but we are transporting it. So it's just a matter of thawing it out and transporting it. And we've got all ready to go.
Have you considered other areas or other buildings for mass vaccination, such as the Cornwall Armories?
Everything is open to us. Everything is open. We're like at this stage, like I said, because of the nature of who we're vaccinating, we're prioritizing because we're just getting it for that. But we're going to be planning now into the next couple of weeks as we get vaccine potential sites. And so whatever you think is appropriate, whatever you can suggest, let us know because we'd like to be able to take advantage of it. Like I said, we've typically been doing the civic complex for mass vaccination, but sometimes nothing's off the table.
Well, I thought the armories you could drive in and out.
Well, that's the thing. We're looking for a drive-through, and that's a good idea to have because we had done a drive-through in Castleman, but you can drive in it, all right? It's a roof, yeah. So in Castleman, we had to go out and vaccinate. So that's a great idea because I was telling my wife I'm looking for something that's covered, like one of these like big maintenance garages or something like that. You go through, have like 4 or 5 people vaccinating at the same time and leave. So yeah, that's something that I take you up on that. We're going to look at that for sure.
Thank you, Madam Mayor. Thank you, Dr. Paul.
Councillor McDonald?
Thank you, Madam Mayor. And Dr. Paul, I don't know when I've heard such grim news, but been encouraged by it simply because of your command of the situation, the statistics and the facts. And it's grim news, but it's not surprises. So speaking of buildings you can drive through, I wonder about our new public works building that for salt storage. And that's okay. So I'll move on to my real question now. What I wanted to know is the staff. Now, obviously, you must have a lot of people allocated to simply making phone calls, doing contact tracing. So when it comes to vaccination, will you be diverting people from some of the contact tracing and into...
Very good question. And that's been eating at me for the last couple of weeks when I've been hoping that when the numbers will go down as we increase our vaccines. Luckily, however, the first month or so of the vaccines, we will not be delivering the vaccine ourselves. We'll be using our EMS partners because we're going to the homes, and the hospitals will be vaccinating their own staff. And so, and then for the second phase, when we start vaccinating front essential workers, we can still use our EMS partners. But yeah, that would be an issue. That's something that we're talking about. We have hired 85 extra people since March, just to let you know, for that. And so I'm hoping that, but we do have contingencies. We have a slew. I'm part of the Ontario Medical, Ontario Health, Ontario Hospital Association partnership that we've done provincially, and we have lists of physicians and others who have volunteered to vaccinate. So we have a whole list. So should we have need for other vaccinators, we have a whole list of that. And then eventually, like I said, at some point, as soon as there's a bigger supply, we're gonna throw it out to all the share it as we do with the flu vaccine, to all family doctors, pharmacies, and so on.
Yeah.
So I think we'll be able to manage it, but we do have contingencies for it. I'm hoping, like I keep again, vaccines up, this down, so I'm hoping, but that has been something that's been bugging us, and we're planning for it.
Thank you.
You're welcome.
Councillor Bennett and then Councillor Bergeron.
Thank you, Madam Mayor, and thank you, Dr. Paul, for providing this data, which is, I think, what a lot of us were looking to see a lot more of. And it absolutely makes it a little easier to explain to our small businesses that have closed when we have actual numbers to show them. So I appreciate that. What you said earlier about what the province may be bringing down tomorrow is something I think that a lot of our small businesses will appreciate as well. It's kind of hard to tell a small downtown business that sells sweaters that he's closed and he only had a capacity of 3 or 4 people, that he made sure we're all masked, and yet he's closed. And you can go to Walmart, which is selling a sweater with 450 of your closest friends, which is what their capacity is, right? So this will be a lot easier for them to swallow. So if you can't buy a sweater here, then you can't buy a sweater there. That's leveling the playing field. So none of our small business that I spoke to wanted to see Walmart closed. They just wanted to see the playing field leveled.
Let me be honest with you. I'm on the public health measures table, and we're the ones that advise the cabinet, okay, through the chief medical officer of health. Over the weekend, 3 weeks ago, and before the first lockdown, I had made it very clear that can we please limit those big box stores, just like they did in Quebec, to have groceries and pharmacy only, okay? They didn't heed to that. And we've been getting tons of complaints about that. I sent another letter and another complaint, and I brought it up again with the public health measures table last week. And then over the weekend, they called us for an emergency meeting on Saturday afternoon. And lo and behold, one of the options on the table is restricting the sale of non-essential items in retailers that are open.
Perfect.
And I'm hoping that they accept it. So this is our recommendation. We strongly endorsed it. I also put in here limiting shopping to only one member of a household. That's the other thing as well.
That's also very key, because I work in the retail sector, and I can tell you the regulations the way they are now pit customer versus the store owners or whatever, because while we would like to say, it would be nice to have somebody to blame for the limiting amount of people, I guess is a nice way to say it. Because right now you're pitting customers versus the store owners or managers. The masks thing, the mask thing is a big one. So I would say the small businesses, the small downtown businesses, for instance, did a much better job with the mask thing than the bigger stores did, because it was easier for a small business to say, you just can't come in my doors without a mask on and not have to worry about it. But the bigger box stores were getting in arguments in front of their stores with customers, and it becomes just not worth the effort, sadly.
I know.
So if in our opinion, in the business I'm in, the mask, mandatory masking should literally be mandatory. It shouldn't be, well, if you have a condition, if you can't put a mask on for 15 minutes to pick up a bag of milk, you probably shouldn't be out of the house in the first place.
I agree.
Okay.
I agree.
So that's a big thing.
We couldn't get that mandatory in. We couldn't. We couldn't. As a long story, but we couldn't, and we asked for it, and the other thing too is we had to do it by health unit to health unit. If you recall, we did it jointly ourselves with Ottawa and Leeds Grenville, and despite us telling the government you should do it and put it in workplaces, they didn't even have it in workplaces before, like factories and stuff like that. They didn't have it in there as well. So at least that's a better step. But you're right, making it mandatory. And the other thing too is you're in everybody's fed up. People are protesting. We've had 3 protests already. Where do you balance it? So I agree.
Because it even creates arguments amongst customers in the store when you see a family of 4 with a smug look on their face that you can't tell me to put a mask on.
Yeah,
that's kind of tough to swallow. But the other thing I can appreciate also, and it's something we tried to implement at store level, but it became very, very difficult. It was creating arguments, is what it was creating, is the 1 person per household shopping. That's going to be very, very welcomed if that actually is what comes through.
Again, that's
a problem.
That's a potential on the table. I don't know what they're going to accept.
I'm glad. Thank you for putting it forward. I appreciate it, and I can tell you the people that are managing these stores are absolutely going to appreciate it.
Yeah.
So keep coming with all this data, because the more data, the better.
Yeah.
And otherwise, thank you for your efforts.
No problem. Thank you.
Councillor Bergeron and then Councillor Mack.
Thank you, Madam Mayor. Dr. Paul, my first question is about the vaccine rollout. You mentioned long-term care homes are the priority. I've received quite a few messages from frontline workers at hospitals at how they believe they should have also been in that first priority group. Can you maybe give that, you did talk about it, but maybe
Yep.
give a little more detail for the people
Yes,
watching?
as a matter of fact, I've been working with our hospitals, particularly our Cornwall Hospital, and we will be allocating a vaccine to them this round as well. And we'll start a vaccination campaign based on priorities. And so we will be using part of that vaccine for our healthcare workers, particularly in our Cornwall Hospital, because it is the COVID hospital and they have ICU patients. So yes, we're starting with that. And then we'll have a regular process. Unfortunately, we don't have enough to give everybody, but at least we're going to start with high risk.
Thank you. There's two motions that I've made today on the council agenda we'll be voting on after you leave the meeting. So it's a bit awkward in terms of process, but Councillor Bennett just asked you about the small business motion. The other one was about data, which you provided today. Is that going to be something that is coming forward on a regular basis?
Yeah. Yes. Yes. I've explained before that the granularity was difficult to get because we changed programs. Oh no, actually I think I told the North Glengarry ones. I'll tell you again. We changed the program, and it was very difficult to get the data. But moving forward from August on, we will be able to get more data and have more of a robust update. So we'll be updating our website on a regular basis with all the data that I shared with you today, and I will. With a bit of report and a bit more granularity. We're also going to be putting our more details. But like I said, now we have a process of at least identifying it. It's very hard to extract. I'm not making excuses, but it is hard to extract. But we will be putting it on a regular basis.
Thank you. I'm still going to put these motions forward. I think they're good that you understand that the community wants this information.
But let me correct you. My whole community. I have 17 municipalities. And I think they all deserve it as well. So it's not just for Cornwall we're doing this.
I can appreciate that. I cannot make a motion on behalf of the United Counties.
No, but for Cornwall, but I'm no, I just want to make it clear that I think that it's important that we all know the data. And but it's also important for you to know what's happening in SDNG and for SDNG to know what's happening in Cornwall and even what's happening in Rockland. So, it's important. So no, I'm delighted that we'll be able, go ahead and do the motion. We're going to follow through. We're delighted. And I'm actually, if I can vote for the first motion, I'd vote with you. Let's put it this way. I like your first motion.
So tonight we're talking about Cornwall. That's the one that we're worried about. And that's the one where the spike is taking place.
I understand.
Yes.
What I'm talking about now is I said to the council that I like the first one as well, his first motion.
Understood.
Yeah.
Understood. Thank you. Councillor Bergeron?
My last question is quite simple. In the data you just provided, it seems to be that a lot of the spread is happening in households. What can be done to be minimizing the spread within households? I myself have daughters who move from one house to the other. What would you say to the people of Cornwall and region?
Tonight it's Cornwall. Tonight we have on our website how to self-isolate in your home. And there's a whole slew of things, but it also depends on the size of your home. Some people are not lucky to have big homes. Some people live in apartments and it's very hard to do. If it gets out of hand, I'll be honest with you, I'm going to start looking at finding places for them. Ottawa has done it. Toronto has done it. Renting a hotel for them. Unfortunately, there are some, and there's a disproportionate number of cases, particularly in low-income areas, where you have that because you have 10 people or 12 people living in a small apartment, or something like that. So it's impossible to do that, and that's what's driving a lot of the cases in Toronto. And really, some of the ones that we're seeing here, it's 8 people in a home. 8 people, 8 kids, 7 kids. And so there are ways that you can do it. If you're lucky enough to do it in a home, you can say, okay, don't share the same bathroom, eat in another part of the house. That's all and well. But if there's increasing numbers of those, I believe, like Ottawa has done, and there has been some federal money, we can, commandeer part of a hotel and put them in if necessary. Because that's the issue. I do agree. It's hard. So you can, like I said, on our website, you can go and see for people that have the ability, the size of the house, but it's hard to do that if you've got multiple people in a small 1-bedroom apartment or something.
Thank you. No further questions.
Councillor Mack and then Councillor Gardner.
Thank you, Dr. Paul. I want to go back to something Councillor Bennett touched on. Do you think the Walmarts of this world are doing a good job at screening people?
On and off. We're on their backs. We got complaints. Our inspectors are in Walmarts more than anybody else. We're going in. We're trying to ask them for the screening. Sometimes we have complaints about poor line control. So we have our public health inspectors know their managers by first name now, because we go in all the time. We get complaints about them all the time. They're doing a decent job, some better than others. And sometimes we have to go in and remind them. One of the things that we saw, I'll be honest with you, when we did our survey, we had about 17 enforcement officers from other ministries come in December 3rd to 5th. And again, we're going to release that report as well. They did about, I don't remember, 150, 200. They did a couple. The highest percentage of people that were not compliant were restaurants and gyms. Yeah, believe it or not.
The other thing too was that the one family member only, but if the store's counting or they have a capacity,
there should be limited.
And say Todd's store, well, if you're counting them, what difference does it make whether a husband and wife goes in, or because capacity is capacity?
I understand, but what's happening, and you'll see Councillor Todd's going to tell you that they're just letting them in. And I've gone and I've seen, a family with 5 kids running around. It's not right. At this point, we're in a pandemic.
Yeah. Just 2 more questions. The hospital capacity. Has anybody from Cornwall Community Hospital expressed concern to you about being overrun, like 5 ICU cases? And you think most of them are in Cornwall?
Not all of them. One was in Montfort, so I wasn't there. But I can tell you they've had right now they have 187 patients with 160 capacity. They're now contemplating, and I can't speak for them, but I spoke to Jeanette this morning, and they're contemplating on looking at contingencies, decreasing elective surgeries, looking at other possibilities of transferring, non-acute patients, plan A, plan B, and plan C. Obviously, we've had that before, even field hospitals. That's kind of part of our plan. But at this point, they're holding steady. I asked her as well, what kind of patients are you getting? What is it? We don't have flu now. The flu is very low, but they have a lot of like 24, long-term care patients waiting to go back in outbreaks. That's overwhelming them. And she said that they have real sick patients that are coming in and requiring hospitalization for one reason or another. So yeah, they're kind of right there right now. And she's going to be sending me daily reports now, so just so we'll know where they are.
I track the numbers every day off your website, and January 1st, 71 cases in Cornwall, 244 today. That's a tremendous jump. Where do you think this can go before it levels off?
I'm hoping it levels off now. I'm hoping it levels off because I'm kind of getting a glimmer of hope. Let's see what the next couple of days show. We'll attribute it to like Christmas and pre kind of, lockdown. I hope it just levels off. I really do. Let's see what happens.
COVID related.
Yeah.
Mental health cases, suicides. Have you seen any uptick in that?
What we're seeing is more mental health. Yes, we're seeing mental health across all ages, particularly adolescents. We're also seeing increased opioid and opioid-related issues. And that's something that we're going to be investigating as well. We have an opioid task force now that's looking at that. And I'm not sure about suicides, but I think that I wouldn't be surprised if we see increase in that. But certainly mental health issues are up across the age groups.
It affects everybody. We had that tragic case in Montreal, young doctor just couldn't take it. Well, thank you, Dr. Paul.
No problem.
Councillor Gardner. Yes.
Me?
Go ahead. We can hear you.
Yeah. Yeah, good. I did it right this time. Thank you for all the information you give to me, Dr. Paul, on a fairly regular basis. I've heard most of this today. However, the new hires, the 86 new hires, I know our staff has been so busy 24/7. I mean, staff is worn right out. If and when we get the vaccine, are we going to have to hire more staff? Number one. Number two, who's paying for this?
The extra money is paid by the ministry. This is, we got our lump sum reimbursement, extraordinary costs. It's the ministry. We got our confirmation that you have to sign as board chair anyway. So yeah, we're that is extra. That is anything above and beyond our regular budget is 100% funded by the ministry, and we got our confirmation of our first quarter spending. And so I'm not worried about that. Should we need to hire more nurses or vaccinators? We do have the budget for that as well. And anything above will be paid by the ministry. And like I said, the 80 or so that we've hired have helped us in testing, because we don't forget we're doing testing. The other thing that we're doing now is we're going to try to divest ourselves of the testing. As you know, we do the testing in Castleman and we do the testing in Alexandria. Where it takes a lot of our staff to do that. We're going to now be focusing and probably using our offices for vaccination as well. Today I spoke to the Hawkesbury Hospital CEO, and they're going to take over our Castleman testing, so we can liberate our Castleman staff, which will be good, and the Alexandria as well. So we have contingency plans on that, but if we need to hire more, but as I said before, I think it's Councillor McDonald, I think, we have a whole list now of vaccinators and others that would want to come and help us as well if we need it.
Thank you, Dr. Paul, and be careful going home. It's not nice out there right now.
Councillor Hollingsworth.
Thank you, Your Worship. Curiously enough, Dr. Paul, I got a question on my phone right now from a resident. I thought it was valid, so I might as well ask it. The individuals said, are we going to stagger vaccines at the hospitals so that they don't have entire departments vaccinated at the same time? The premise is that the second dose could conceivably have side effects, and so in which case you might have an entire staff incapable of working. So I guess the question is, are we going to stagger vaccinations in the hospitals as such so that whole departments are potentially facing side effects at the same time?
That's a good question. That's something that we're pondering, not only for our hospitals, but also for our long-term care staff. And some of my colleagues have started to stagger, but what we've been seeing, both with the first and second dose, that the rate of side effects is very minimal. And so we're discussing staggering or not, but we have at this point planned to stagger. Yes.
Okay. Thank you. Thank you, Your Worship.
Any other questions from council? Councillor Bennett, did you want to add anything in response to the stores in particular?
Yeah, thanks. Just to Councillor McIntosh's point about the store capacity, he's 100% right. There is a store capacity, we'll let them in. The problem with not limiting the shoppers to one per household is that if a family of 4 goes in and they're taking up the spot of 3 other people that could be shopping, and the family of 4 is a cluster and they're blocking aisles, make it difficult for people to go around them. So it's got 2 benefits. It's that the people who are in the store are actually shoppers, and you're not creating blockages in aisles and whatnot. So I think it's an important piece of the puzzle if it does come out tomorrow.
Dr. Paul, I am very anxious for our community. And when I say our community, I sit here as the mayor of Cornwall, so I speak of Cornwall. I feel a bit like a mama bear right now. I just want to make sure that we're safe and that we're doing all that we need to do. So I have a couple of questions. The 71 cases that have been added, those have been added in the last 2 days. Is that just from the last 2 or 3 days?
It's only over the weekend.
Only over the weekend?
Yeah.
And you said earlier that when you were doing the contact tracing, and I thank goodness that the health unit is on top of contact tracing, unlike other areas I hear, that you're noticing 7 and 8 contacts per person?
Up to that. Is
that a good number or a bad number?
That's I'd like it to be 1 or 2. Let's put it this way. I'd like it to be under, it ranges. We've had one with 22 contacts, by the way, but that's another issue. It ranges from 1 to 22. I was just looking at the numbers this morning. I would say the average is probably between 6 and 8 is what we're seeing. And I can tell you that if we compare it to the limited number we had in the March lockdown, it's higher now.
Okay.
Okay, which tells you, more people are more out there.
So thank you for releasing the data. And I'm glad to hear that it'll become even more granular. I think that's very important. I recommend everybody go and look at Nova Scotia and the information that they're releasing. Their health sector is releasing very industry-specific information that's very helpful for small business and big business to understand what's happening, but also for people to understand the risk around gathering. So I'm just putting that out there.
I'm gonna look into it.
Yeah, Nova Scotia the information is it's fantastic.
Okay.
I have a question about how you're prioritizing the vaccine rollout. So will you be prioritizing long-term care facilities in outbreak? And since we're going to be very excited to see vaccines show up in Cornwall, the first place that it goes to, that's very exciting. You're going to want to explain why that place was chosen, because the public, you want to anticipate questions around how are you deciding and prioritizing? So I guess the question is, how are you doing that? And are you going to be speaking to the public about that? And are you prioritizing long-term care facilities in outbreak?
Yes. First of all, the outbreak ones theoretically are a bit tricky. Our initial, believe it or not, ironically, we were told not to vaccinate outbreaks because a lot of people are positive and so on. So we're going to be not using that premise. They've left it up to the individual medical officer of health to decide. I mean, if you have an outbreak of one person in there, you're not gonna not vaccinate them. We have a risk analysis of all the homes, the long-term care homes that have done through the ministry and us, and we'll be using that to guide us. That is the most fair way. The highest risk ones get vaccinated first. Although I do believe that we only have 18 homes and it won't be too long before we do them all. Let's put it this way.
Okay, but the first one is important, right?
Yeah, the first one is going to be based on our risk, and we're going to have that. We'll share that, and we'll share the list because that's been given to us through the ministry and through looking at a variety of factors that risk them into red, yellow, and green. Like there's a whole risk. So we're going to start with the higher risk ones.
I wanted to ask you about enforcement as well. I know that your staff are doing contact tracing. Is your staff still available to do enforcement around, and particularly any changes that come up tomorrow that the Premier is going to announce?
Well,
how are we going to enforce any of that?
Well, that one is a difficult one. We do have a team we have a duty desk that does some of the enforcement with our public health inspectors, but we don't have that many to go around. So we are working with our police partners. We are looking with bylaw. We are working with a variety of partners to, if we can't do it, they're very helpful and they go and enforce. We get a lot of the complaints. I give an example. We had some issues with people telling us to F off when we call them about contact tracing. So we send the police to their house, because it's a section 22. And so those type of things. So yeah, we're trying to do those. What we're going to do is as soon as we get the new, whatever they pass tomorrow or whatever comes out, we're going to meet all our bylaw, all our enforcement partners and see, first of all, try to understand what is, new and what is not, and then see what we need to do in terms of enhancing the enforcement and identifying how we can do it. Typically what happens is we get the complaints, and if we can't handle them, or sometimes we need help, we call our partners, depending on where they are, including Chief Aikman and, the Cornwall Police. And so depending on where they are, we will be doing that. One of the things that we think is necessary, and part of what we recommended, is you have to have increased enforcement as you have the increased restrictions. So that's something that we want to better understand. We have been asked, we asked the ministry, look, how can you help others? Because sometimes we're saturated. So once we better understand what the new restrictions are, we're gonna be looking at what can we do, or what's required of us, because some of them may require more enforcement, and then we will see how we can separate it in terms of, do we do it, do you do it, do we do it together, that type of thing. So like I said, it's police, it's bylaw, and it's us as well.
Two more things. Hospital. Like Councillor Bergeron, I have had very much contact with hospital workers. Our regional hospital is the COVID hospital. It's at capacity. And so I just am glad to hear that they are going to be vaccinated on a priority basis. And that's part of this first phase.
Yes, they are. Yes, they are. And I have to tell you, I had to fight for it. I really had to, anyway, it's a long story, but they will be getting vaccine. Not as much as we'd want, but at least we're starting. And I've asked them to prioritize it, ICU and those type of things. And then we're going to work with them. We're going to work with the chief of staff. We're working with the CEO and others to be able to ramp it up and continually provide them vaccine on a regular basis. So that and the thing is that they're ready to go. We've got everything ready to go for them. They put the computer system in. They've got their bookings. So they've got everything ready to go. They just need the vaccine and they're on standby for it. So, and I clarified that with them this morning, actually. So.
Good. I'm glad to hear that you're in constant contact with Madam CEO of the hospital, because that's a major issue. And there are a lot of potential vaccinators there too.
Yes.
So I'm glad to hear that.
Well, it's helping us that they vaccinate themselves. So at least that takes, because they have 1,500 employees. So, we're just telling them, here's the vaccine, go for it. Thank you very much. That's what we want. They're helping us as well. The pharmacist is going to be helping us because, like I said before, there's a bit of a trick to diluting it. And if you do it properly, you can get a 6 dose out of it. So Mohammed, who's the pharmacist, is already part of our meetings, and he's going to be actually coming with us to the homes.
Okay. Last thing, from my perspective, I understand that you want to be hopeful, and we are all hopeful, because there's a horizon. What's different about this lockdown this time is that we know the vaccine is coming.
Yeah.
So we have a right to be hopeful. But this spike is significant.
Yeah.
And so hope has to be followed up, supported by solid action. So what I'd like to know for our community, what's the action now that we take to stem this tide? We have a spike, and the vaccine is coming, but it's not yet here for all of these adults between 16 and 60. So what do we do differently? What's the health unit going to do in terms of education? What do you need us to do to heighten the message? Because I don't know if everybody has the same listening. We're tired.
I agree.
We've heard these messages before. So what do you do differently? What do you need us to do to heighten the message? Because hope is one thing.
No, I agree.
But it has to be on the basis of solid action right now.
And that reminds me, just because we're having a vaccine doesn't mean we've got to be complacent. That's the other message that we have, because people, vaccine's coming, no problem, and that's not what we want. Yes, the situation is serious, and the best thing we can do, stay home. I'll be honest with you, as much as you can. Don't mingle with others, and take the necessary if you're going to go out, take all the precautions. Very simple. It's not that hard. It's the mobility. It's the mixing with others that we're seeing. So these measures that are going to happen now will not work unless people heed to staying home, going out only for essential purposes. Obviously, if you're working, it's another thing. And if you're working, make sure that you don't take for granted that you need to take those precautions. People are forgetting to mask. People are forgetting the social distancing at work. These are very simple. It's not very difficult. I know it's the same message, but there's not much else we can do.
Is the health unit going to do any additional outreach or anything?
Yeah, we are. We're actually preparing a whole summary of the contact, all the stuff that I presented to you, what the contact tracing is, what we should be doing, and so on. Where we found this and what we found. Yes, we've actually got a couple of programs ready to go, based on some of the data that I showed you as well.
Dr. Paul, I'm going to join Councillor Gardner in wishing you good health, you and your family. It is most important that you stay well.
for your sake, but for ours as well, in light of all of your responsibility for our communities. And I want you to make sure to thank your staff. We know that you and your staff are going above and beyond, and we recognize that. We know that there are no excuses being made, but we also, and I also will not apologize for being worried and for wanting data and for heightening the message at this time.
And I want you to heighten the message. I think we have to have a heightened message. I think people have got to get it. I was always worried about this, as you know, back then when we had 20 cases. I said it's not over, and now it's here. But I also believe that we should empower the people and tell them, listen, it's only a matter of time, but we need you to do this. And that's what my message is going to be. That's what it has been. So I'd like that to be amplified by yourself and your counselors. We have it, the light's there, but we're not there yet. However, I think it's very important what you said, unlike in March, we were all dark, didn't know where we were going. Well, at least we have some kind of something to look forward to. And I want that to be used as an inspiration, but not as a excuse to be complacent. That's my fear.
We're in the home stretch. Can't let go.
Yeah.
Thank you, Dr. Paul. Merci beaucoup.
My pleasure. Merci. Good night, everybody.
Madam Clerk.
Business parking, with a recommendation that the city continue the current free 15-minute curbside parking in the downtown and Le Village for the period of the provincial shutdown, and B, that council reinstate the original parking program which existed prior to COVID-19 following the provincial shutdown.
So I'd like to ask Mr. Boileau to make introductory comments here. This is essentially his report, his department's report, and he is on screen. Mr. Boileau.
Thank you, Madam Mayor. I believe you can hear me okay?
Yes.
Good, thanks. So it is authored by myself, but with the assistance of Tracy Bailey in finance and with Maureen as well. It's kind of got two parts to it, and the first is the financial part, and I'll begin by talking a bit about the 2020 budget. So as the report indicates, it had a budget of $673,000 and a few odd dollars. We expect a shortfall on that budget of about $340,000. The Safe Restart Agreement will help to offset that figure. Going forward, and I suppose a commentary on the use of that $340,000 for the Safe Restart. The program is really set up to try to put into place to offset pressing needs in the community. And so while the city did apply that money to this fund, going forward, the city may choose to do the same, or may choose to look at other funds that are being depleted. So I just wanted to make the comment that the Safe Restart has been very helpful to us in trying to deal with that shortfall. It's really up to council, I think, going forward, if funds are available to us, whether they want to apply it to that item or whether they want to apply it to any other community needs that may arise. The 2021 budget has been set up with what I suppose you might call normal service levels. And of course, this was started, the budget process for administration started some time ago. And at this time, of course, COVID is probably not going as well as we would have hoped. And so there certainly will be an impact on the budget with certain things, perhaps like parking and in fact, a whole bunch of things that are affected because of COVID. But I just wanted council to be aware, and Ms. Bailey is with us as well. She can provide some commentary on the budget preparation, but just to make everyone aware of the fact that the budget has been established with sort of quote unquote normal service levels. And so, for example, what Ms. Bailey and I were working on is that if we were looking at a year where we provided complimentary parking for the year, you would be looking at, and the service requirements remain the same. So in other words, complimentary parking doesn't mean that there aren't costs. My report on page 86 in the third paragraph gives examples of what costs continue to occur even when you're not charging for those services. So the paragraph that relates to bylaw enforcement, city equipment rentals, lease agreements, parking lot maintenance, which is a big piece, and other smaller items such as taxes and electricity and so on. So if, for example, the city were to not take in any revenues, those costs continue to occur. I want to talk a little bit about the operational side now, and so the recommendation is as described by the clerk. We have put out the curbside parking because, of course, of the situation we're currently in. And with the assistance of Municipal Works, we were able to put that signage up fairly quickly. And I think in my driving through the community, through the downtowns, I'm noticing that I think it's fairly ample in its availability. People seem to be using it. There's very little activity that is normal retailing in the commercial areas at this time, of course. And so I'm not quite sure how much the 2-hour parking is helping, because for the most part, people are driving downtown, doing curbside. There are some other things that they can be doing, I suppose, in the downtown, but the 2-hour is, I think, probably not having quite the impact that it had when stores were open. I do want to say, though, that there are a whole lot of signs that are out there for 2-hour parking. So, for example, even if council decided to eliminate 2-hour parking today, it would take us probably to the end of the shutdown for us to remove signage, notify the public, alter the equipment that we have out there, so the paying machines and so on. So it's probable that what we're talking about is that we're providing curbside until the shutdown at least, probably continuation of 2-hour parking for what it's worth until the shutdown is complete, because we think that a turnaround on eliminating 2-hour parking would take certainly as long as that. Those are generally my comments. I'm not sure if I'm certain there are questions, and if they're more financial, perhaps Ms. Bailey can assist as well, but I'm happy to answer any questions.
Of course. Council, questions and or motions as well. Councillor Towndale.
Thank you, Madam Mayor. I had some questions. In reading the report, well, thank you for the report, first of all. One of the points that was noted was that the impact is hard to measure. However, did we reach out to the DBIAs, the two of them, or the chamber to see if there was any feedback?
Mr. Boileau.
Yeah, I mean, quite honestly, the feedback is that they appreciate it. The point I'm making is that I think from a very purely monetary perspective, it's very difficult to measure, especially if we if we, at the end of the day, what the statement there is about, is it affecting decisions of whether to go to a restaurant, to shop in the downtown? That's the point. I think the other statement that's in the report speaks to the benefits of subsidizing transit, for example, which may have a greater subsidy need for transportation to the downtown than parking. So I think the answer to your question is, I think most retailers would say that they see it as an advantage. Again, I'm not, there's been no way of measuring whether it's affected people's decision to either to go downtown versus to any other location, or to shop downtown or to any other location.
Well, thank you for that. Through you, Madam Mayor. Well, I would argue that we could ask. I mean, we could ask the businesses, have you seen an uptick? I mean, obviously now everything's locked down, so it doesn't really apply. But I think even if we canvass people in the public, they may have some input on that matter. I'm glad you mentioned transit, Mr. Boileau. I think they're two different things. They both relate to transportation in an aspect, but I think, it's different. There's different clientele for both. Realistically, generally people use transit, not exclusively, but they may not have access to a vehicle, whereas people who are looking for parking do have access to that vehicle. So, I mean, it's two separate things in my eyes. But realistically, in my opinion, and I could be the only one who feels that way, I don't think we're ready yet. I really don't. We just hit the second wave. Small business is still hurting. With the lockdown rules, it's still an issue. I get it. Some of them are closed, or some can only offer curbside at this time, but I really don't think we're out of the woods yet. So I would be in favor of maintaining what we're doing currently. I just don't think we're ready to go back to the original system just yet. I think I know it's a budgetary hit. I get that. I know it's a huge financial hit that we're taking, but I think in that sense, we're showing our support for small businesses, especially downtown and Le Village and wherever else. And I think we need to do that. I think we need to try to give every advantage we can to our small businesses during this pandemic to try to alleviate any sort of barriers to ensuring that they can continue operation while through this pandemic and survive it, quite frankly. So that's just my position on that, and that's where I stand. So there's no motion on the table right now. I would put one forward potentially to stay the course, or if someone beats me to it and puts forward a motion to pass this, I'd vote against it. Thank you.
Councillor McDonald and then Councillor Hollingsworth. No, you're muted. You're still muted.
Thank you. And I agree with Councillor Towndale that we're not at the point yet when we should be making any changes. And we can't even evaluate what advantage it is to anybody right now because we're in lockdown. Nobody can go anywhere downtown. So the 2 hours is, it's not a valid question at the moment. But I fear that we have let a genie out of the bottle, and I'm happy to see it go because people resent paying for parking when they don't have to do it everywhere, or they only have to do it when they're downtown. And it's not just a small business thing because small businesses aren't all limited to the downtown area. And I think that maybe one of the effects of COVID is going to be that we're not going to get that genie back in the bottle ever. And so maybe we have to look at something else. That's my opinion.
So
Mr. Boileau, please.
Sure, yeah. You may be, it may be correct that parking, certainly there's been discussions of should we have parking that is free in the downtown. That conversation has occurred over the years. It really comes down to whether you want the user to pay or whether it is applied to the general taxation. I think that was really the purpose of Tracy and I's putting together a little bit of an estimation of what we think it would cost annually to provide that free parking, and that's why that figure is there of $400,000, which is our estimation of what it would cost if we provided free parking in the downtown. And it really comes down to whether council wants to do it that way or otherwise.
Councillor Hollingsworth and then Councillor Bergeron. And I have you there, Councillor Duppel as well.
Thank you.
Councillor Hollingsworth.
Yep, voice is already cracking. One question, Mark, and I'm not sure if I understood you right or not, so I might be already asking something you answered, but technically speaking, in light of the fact that essentially both the downtown and, for the sake of argument, the BIAs are shut down anyway, how much revenue, let's pretend we said, okay, we don't want to change course, we want to continue with the 2-hour parking until essentially this whole lockdown is behind us. That being said, is it safe to say we probably wouldn't be generating a lot of revenue right now anyway, because there's nowhere to go downtown? Like, there's no reason to park there. Even if we said we wanted people to put their tuning in, nobody's going to be doing it anyway. So I guess the question is, why would we change course now when we can't? I can't imagine us making a lot of revenue at this point anyway. Or is it because you just think it's going to take that much time to change gears so that when this lockdown is over, we're ready to go? Is that really what it's boiling down to?
Mr. Boileau?
Yeah, through you, Madam Mayor. I think the answer, certainly in the next little while, is that activity is certainly now is almost non-existent, and that's the purpose for me driving around and having a look at things. So the revenues and the table that we provided you with the financial information for, you look at 18, 19, 20 to see the comparators. Certainly COVID is having a serious impact on payments. So there's not an expectation by us that absolutely now there is no collection happening. I can tell you as well, by the way that the motions have come from council, there's been a bit of a void in the month of January to date, because the motion was dealt with everything to December 31st. And so we don't have a direction really from the 31st to now. So, but I can tell you that we made a decision to not charge and not ticket cars, because we expect that the activity is fairly low anyway, and we wanted to make sure that we waited to see what council's direction would be. I also want to point out that some of the decisions that, sorry, not decisions, but the information that we've provided to you, we've looked at other communities. So for example, in the city of Ottawa, it was interesting that just this weekend, they talked about how the merchants are trying to get the city of Ottawa to provide that 15-minute free COVID parking. So that even, the city of Ottawa doesn't even have that. So I think the provision of COVID parking now, and for certainly until this shutdown is over, is probably the most important thing. But in terms of, going back to your question, in terms of collecting revenue now and in the very foreseeable future, our expectations are for small revenue.
Okay, thank you. That being said, for the record, Your Worship, I'm not a champion of the taxpayers at large paying for free parking downtown or in the BIAs. I don't think that somebody living on 5th Street should be footing the bill for parking downtown in general. That being said, I probably will vote against the recommendation, not because I'm a champion of free parking, because I'm not. I mean, other businesses who don't live downtown pay for parking at their businesses. They pay insurance premiums. They pay for snow removal, and the city of Cornwall doesn't pick up the tab for their parking. Just saying. So I'll probably vote against the recommendation, not because I think that the city should pick up the tab for parking in general, but quite frankly, I don't think we're going to get a lot of revenue right now from parking anyway. And so I'm more inclined to wait until the lockdown is kind of passed and we get a sort of handle on it, because I don't think we're losing a lot of revenue right now. Certainly when the lockdown is over and businesses can potentially try to, get up and running again, I would be prepared to support the recommendation then. But right now, in light of the fact that we're not getting a lot of revenue anyway, and I think we need to try to help businesses however we can, be it as small as it is right now in light of the lockdown. So I'll probably not support the recommendation currently, but post-lockdown, I probably would. Thank you, Your Worship.
So there is no motion yet. There is no recommendation.
The
No, that's
recommendation.
fine. No, it's fine. I'm just explaining that there is no motion on the table, and that there is a section A and a section B. So, council can decide whether they just want to go with A and not move forward with B. That's up to council. But I'm just going to continue on my speakers list until I hear more information around a motion. So I have Councillors Bergeron, Dupel, Ibal, Grant, Bennett, and then Mac. So we'll start with Bergeron and then Dupel. Councillor Bergeron.
Thank you, Madam Mayor. I echo everything that Councillor Towndale mentioned at the beginning. I was assuming we would go back to him for the motions, and so I wasn't going to make a motion. I would support item A. I would not support item B. So it's difficult for me to support this motion recommendation as is. I would really like to see item B as a topic of discussion at budget, which is 2.5 weeks from now. I would love to just push item B just directly to our budget meetings. I frankly think we'll still be in the lockdown.
Yes, probably.
So I don't know how to word these motions. I'll defer that to Councillor Towndale because I supported everything that he said.
Mm-hmm.
One point of order, though, or one clarification for Mr. Boileau. You mentioned that when Councillor Towndale asked about if you had spoken to the DBIAs, I sit on the DBIA. I don't remember it coming to us. Can you clarify? Did you get information? Did you ask the DBIAs for feedback on this, or is that coming?
Mr. Boileau?
No, I have communicated with the DBIAs in the past. I think I have their opinions fairly clearly, which is that they support, going back to their letters, in fact, they were requesting a 1 hour complimentary parking. You'll recall that the motion from council was to provide a 2 hour complimentary parking. I know that they are supportive of the idea of providing that subsidy to the downtowns, both in Le Village and downtown. And I believe that their positions have not changed on that.
Thank you.
Councillor Dupel and then Councillor Ibach.
Thank you, Madam Mayor, through you to Mr. Boileau or perhaps Ms. Bailey. As I go through, I appreciate the report that has been provided to council tonight. But as I go through it, is there any way to tell exactly what the dollar amount is from the 2 BIAs that we're losing? Because I get all of the expenses, I understand that, but is there a way to look at what revenues we're actually losing from the 2 BIAs that we're speaking about?
I'm not sure whether Ms. Bailey can provide details about how. So what we're looking at, if we go to page 106, what we're talking about largely is the center section of that report or that table. So the meters and the pay machines, for the most part, the meters and the pay machines are the two BIAs. So you can see quite clearly that in 2018, you know, we collected about $265,000. The next year we collected 261. We're at about $83,000 for 2020. And certainly you can see there as well the impact that it had with, you know, COVID occurring. So post April, I would say, you started to see a very significant impact. So I'm not sure if Ms. Bailey has anything further to add, but largely what we're talking about when we're talking about the BIAs is that meters and pay machines collection.
Ms. Bailey?
Through you, Madam Mayor, I was actually going to direct council to that exact chart. Thank you.
So for you, Madam Mayor, the meters and the pay machines, the difference of the 261 from 2019, we're at 83,000 for 2020. That would be the difference that we're sort of losing as revenues for offering the 2 hours of free parking.
Ms. Bailey?
Through you, Madam Mayor, it is a bit more because we do compare it to budget and not to previous years. We base revenue on trends and other things. So when we're looking at a loss, it's in comparison to budget.
All right. So do you know what that number is compared to budget? Through you, Madam Mayor?
Through you, Madam Mayor. Yes, the report notes that for 2020, the loss is about $340,000. Mr. Boileau and I took a look at complimentary parking, 2 hours, and what that may look like for the year. And we think it's probably about $300,000 for the parking program.
For just the two BIAs?
Correct. For the parking program in its entirety. So if council approved a 2 hour parking for the community, that would be a loss of approximately $300,000 in revenue net to the program.
Okay. Thank you, Ms. Bailey. Thanks, Mr. Boileau. Thanks, Madam Mayor.
Okay. Next speaker is Councillor Hébert, and then after that, Councillor Grant.
Thank you, Madam Mayor. I guess I want to go back to the comment about transit and parking not being the same. I'd have to disagree. And it seems as though with transit, we've phased back in our fees without really coming back to council as a vote. And so from what I understand, transit users are paying that full price again, the $3 if they don't have a pass. And unfortunately, I think we were wrong there. I feel as though if we're going to, before the lockdown period, of course, encourage people to come down to our downtown, we waived parking completely. So those with a vehicle had that added benefit to go downtown because there was no extra fee. But if I didn't happen to have a vehicle, maybe I'm a lower income family, I still have the right to shop, but it's now going to cost me $3, possibly $6 to come downtown to shop if I don't have time to do a transfer. So I don't want to let, like Councillor McDonald said, that genie back out of the bottle because we got it back in, and it is a user fee, and I certainly want to see that fee continue, but I wish we would have done the same thing with parking. Parking is another user fee. Parking has a cost. Parking will never be free. And so here we are subsidizing shopping for those who have the luxury of having a vehicle, but not those who don't. So it's not fair. But I'm not quite sure exactly how I'm going to vote on this situation. I feel as though if folks are only doing curbside, they shouldn't be parking downtown for more than 15 minutes anyways. There's really no other reason to be downtown. If you are working, you shouldn't be using, on-street parking. There are designated parking spots for employees. So I can see us delaying this a little bit further into the lockdown, but I certainly would hope to see a regular parking program come back into effect as soon as possible, because we are subsidizing for potentially non-taxpayers as well. So anyways, those are just my comments. I'm not letting any other genies out of into the universe so that we can rediscuss the whole transit issue. I don't want to start that, but I just want to make that quite clear that there are people that are certainly struggling more than others during this pandemic, and we should have been more considerate when phasing our fees back in.
Councillor Grant and then Councillor Bennett. There you go. No, you're muted. Okay, we can hear you.
I don't know how I can get muted because I haven't taken it off. Anyway, I think we should continue on with subsidizing the parking for the downtown levelage. I listened to the costs associated with it, and I think we should have a study later on to talk about the whole parking issue, downtown levelage, not necessarily in the off-street parking, but I think because the major costs that we have are for equipment and manpower. And I think we can have a phone discussion on that and with the downtown BIAs and look at that in the future. But I think, as most people have said, the businesses downtown need assistance at this time, and I think we should continue with that assistance. But I would like to have a further study to look at parking, on-street parking in the future, whether we put a little task force together or just have a small committee looking at that and come back with a recommendation to council to look at parking in generality.
Councillor Bennett and then Councillor Mack.
Thank you, Madam Mayor. I agree with Councillor Grant with his last statement about we really should put a group together to really look at this once and for all, so we're not having to deal with this every 3 months. As far as option B goes, every time we have this discussion, it always seems like it's an either or. And so that's why I think Councillor Grant is correct in that we should really put a group together to look at this, because maybe we have to go to a hybrid of what we're doing now. It doesn't necessarily always, for instance, I'm on my bike a lot in the summer times, everybody knows, but when I go to different communities, a lot of them that I visit, the downtowns are free parking for 30 minutes, 1 hour, up to 2 hours for some. But as soon as you go off the street to a parking lot, you're paying full pin to park at a parking lot. So I don't think we have to have free parking across the board, but maybe a half hour is fair. If you're running into a store real quick, maybe you shouldn't need to pay if you're just going to be 20 minutes to half an hour. But if you're going to be down there for several hours, well, now you're tying up a parking spot, so maybe you should have to pay there. But the parking lots themselves is where the costs are. We're going to plow the street anyway in the winter. We're plowing it anyway. That's not costing us anything extra, but it does cost us to plow the parking lots. So if we had full parking at parking lots, and then in front of our businesses in the village, in the downtown, and most businesses that have parking meters in front of their businesses, maybe we have to look at half hour, maybe an hour free parking. I don't think we need the full 2 hours. I think that's a little bit too much. I think 30 minutes is probably a good number. The other thing is, we always hear the argument that the bigger stores, they're paying for parking lots and all these things, and so it's free to the customers. The people that are parking need to know you're not parking for free at Walmart. The cost of the goods are including what it costs to clear that parking lot. So there is a cost. So we just can't be free throughout the city. That I won't support, but I don't see any problem with getting a group together, looking at this finally, and just coming up with an actual plan, so we don't have to deal with this every 3 months that it comes up. But maybe we have to look at a hybrid. So parking in a parking lot, absolutely, that's costing us money to clear and maintain. So yeah, there should be a cost there. The other thing though is, we're kind of in the customer service business, and the customers that are parking downtown hate those meters we have now. The older community, people with mobility issues, have to park, and they're not. For you and I, it's not a big deal to walk five storefronts to a thing and get our tag and bring it back to our car and go. But if somebody has mobility issues or any issues at all, that's a bit of a barrier. To me, we made a mistake getting away from the meters. I know it's more convenient for us, but we aren't the customer. Our residents are the customers, and so maybe we look at that too. I mean, I don't know if going back to what we did is possible, but again, if we put a group together and look at all these options, it's at least then we can make a solid plan going forward, and we don't have to have this conversation every 3 months.
Councillor Mack?
Well, the downtown parking is not a new issue. It's been around for what, 55 years. It keeps coming up every now and then. I take you through the old papers I have here, and it's always been an issue. It just comes up at different times, and COVID has brought it back to the surface. You know, when you give something away to people, it's awfully hard to take it back. And that's the situation we're getting into now. It's almost become a norm now not to pay for parking. I think it depends on what kind of a business you're into downtown. Our family business has been around for 35, 38 years. 10 of those years was on Pitt Street. We never lost one person because they had to pay for parking. And that's the way it was. We have a huge parking lot now, put 20 cars in it, and it hasn't increased business any. People don't say, oh, you got free parking, well, I'm going to go there. But if you're maybe in a different business or retail, perhaps it might be an issue. I've never said, oh, I'm not going to go downtown and get the sweater because I got to pay 50 cents for parking, so I'll head up where it's free. I've never done that. I don't think most people don't, but we're not taking any revenue in now. Going back to what Dean said, we're not taking any revenue in now anyway, and it won't be for, I think this lockdown thing's going to last for another 6 weeks or so. So maybe we can revisit this when things go back to normal, if there's ever a thing called normal. When it comes to, if you had free parking and there's a revenue loss, we wouldn't have the same staffing, would we? Mark, could you answer that? We wouldn't need the same guys putting tickets on windshields and taking care of meters and whatnot.
Thank you, through you, Madam Mayor. I think I've explained before that we used to have 2 people who were dedicated to parking, 2 people dedicated to property standards, and 1 did general. We've changed it so that there are 5 people doing all of those subjects. So if we didn't have the parking program that we have now, if there was one that was either a hybrid, as Councillor Bennett describes, or one that is entirely complementary, you would still require a little bit, not the same commitment as you would now, because now we're ticketing more on cost, or people aren't paying. But you wouldn't lose, like, you still have violations, right? You've got the violations that don't go away. They're not cost related, they're not payment related, they're about violations of other types of fire hydrants, intersections, etc. So you'd still have that. What I would suggest is that, in my experience, we could do a little bit more with property standards than we currently do. And so if we were going to if we were going to lose a little bit of requirement or gain a bit of staff time from parking, I would want to dedicate that to more property standards. So I don't know that we'd see a staffing gain. I think we'd probably, we have 5 people, we have those 3 subjects to deal with. I would recommend to council that we not reduce our staff, but that we, if we weren't having to worry about ticketing on payments so much, I'd love to see that dedicated to property standards, because there are a lot of issues there.
You're right about that. That's a fair comment. Just before closing here, Todd Bennett brings up a very good observation, and it's one that nobody's burning up my phone lines on this, but it has been mentioned about the idea of having to walk to a machine and walk back to the car. I realize it's pretty hard to go back to where we were before, but it is an issue with some people. But, I saw a guy one day, he was walking from Pitt Street, he was wandering around, where do I go to pay? And that kind of thing. But that's progress, I guess.
I just want to make one clarification. The machines we currently have, you don't actually go back to your vehicle unless you can't remember your license plate.
And I'll bet you 8 out of 10 people don't know their license plate number.
Yeah, normally the comment I hear is you make the mistake once or twice, but then
Yeah.
you remember it.
Very good. Thanks, Mark.
Okay.
Any further comments from council or a motion? Councillor Towndale, and then Councillor McDonald.
Thank you, Madam Mayor. Thank you to my colleagues for their comments. At this time, since we've come around, I'd like to put forward a motion that we continue what we've been doing and we revisit, I guess, someone mentioned 6 weeks. That's probably a fair number. I mean, tomorrow we know there's new information coming from the province, what that looks like, but we continue what we're doing for at least the next 6 weeks, if I can get a seconder.
I'll second.
Councillor Mack seconds. Okay, the debate is on that motion. Do you have that motion clearly noted, Madam Clerk? Madam Clerk, do you have the motion noted?
It would seem that that would be the A out of the recommendation. Would that be correct, Madam Mayor?
Okay, I'll go to Madam CAO and then I'll wait to hear from Councillor Towndale on that. Madam CAO?
I think Councillor Towndale said continue with the status quo, so that would keep it, I think, fairly simple if we continued with what we currently have for 6 weeks. Or did you want to just go with 15-minute curbside parking?
Councillor Towndale.
Thank you, Madam Mayor. Yes, I'd like to go with the status quo, what we've been doing for the past little while, and continue that for 6 weeks. So no change, essentially.
Right.
The seconder was Councillor Mack, I believe.
Right.
Are you okay with the wording of that motion?
That's excellent.
All right, so we are now debating the motion. I had Councillor McDonald.
I was going to make that motion precisely, so thank you.
Okay. Any further debate on this motion? I'd like to say, oh, Councillor Bennett, go ahead.
Sorry, a little late to the party there, Madam Mayor. I really think we need to look at Councillor Grant's idea about putting a group together to look at a permanent solution to this. So I don't know if you want to word that into this motion or if we can just take it for granted that the administration will look at maybe doing something like that. But I don't want to leave Councillor Grant's idea off the table either. It definitely warrants a discussion.
Well, the motion is as it's drafted. So if I don't see any willingness to change it, then we continue to debate the motion as presented by Councillor Towndale. Okay.
Sorry, so could I put an amendment to the motion then?
Madam
Would
Clerk?
that be in order?
Madam Clerk?
We would have to listen to the amendment to see if it's in order.
Councillor Bennett?
Okay, could I put an amendment on the motion that we put a working group together to look at a permanent solution for parking?
So there would need to be is that in order, by the way, as an amendment, Madam Clerk?
No, I would say that is a completely different motion.
Then I'll make a different motion when we're finished here then.
Yeah, it can come subsequent. That's fine. Was there any further discussion on the motion made by Councillor Towndale and seconded by Councillor Mack? I'm interested in your next motion, Councillor Bennett, so I encourage you to do that. I would like to say that I will support this motion, but there's a lot of money that is being taken away from the budget, and we're going to be going through some difficult discussions. So while it is important to show support for small business at this particular time in history, especially with what's going on, it's also very important for our community to understand the cost of that. I also liked the comments that Councillor Towndale made about, asking for how we measure that, the help to small business, or can we ask them about that? So there's still that a working group may get at in terms of measuring, you know, how this really supports small business, but symbolically it certainly does. And so that's important. But $300,000 to $340,000, hey, that's a lot of money that a lot of people are going to be paying. To Councillor Abow's point as well, right? So, you know, we have to start looking at how we define fairness here as we go through this pandemic, and so many sectors are suffering, right? So I'm going to support the motion, and then look forward to a working group drilling down into these discussions if Councillor Bennett makes that motion and it passes. All in favor of the motion? Against? No against? Carried. Councillor Bennett.
Thank you, Madam Mayor. I would like to, at this time, make a motion that we put a working group together to look at a permanent solution for the city's parking.
Is there a seconder? Councillor Grant. Is there any further discussion concerning this motion? I see Councillor Hollingsworth.
Thank you, Your Worship. I'm going to vote against the motion. I think the current program, COVID aside, seems reasonable. You know, parking shouldn't, the John Q. general taxpayer shouldn't pick up the tab for parking for business people. I just don't think they should. If you get into business, for anybody outside of the, you know, the BIA kind of areas, they pay for their own parking. They plow their parking lots. They fix the potholes in their parking lots. They carry the insurance premiums on those parking lots so that if somebody slips and falls, you know, that they're covered. And now with some kind of a task force, we're going to oblige those businesses outside of the BIAs to dig into their pockets again, take their taxes and use that to subsidize the businesses downtown. I realize that my colleagues are trying to find a solution that makes everybody happy, but I think the current solution we have is fair and reasonable and equitable. So while I appreciate what my colleagues are trying to do and laud them for their attempts at trying to, you know, find a solution that makes everyone feel satisfied, I think the current one is the most equitable, and therefore I will not support the motion. Thank you, Your Worship.
Councillor Grant.
I just want to basically say, Councillor Hollingsworth predisposing what the working group is going to come up with. So the working group is to look at hopefully a permanent solution to the parking issue, and where the costs would be associated with, and where the enforcement would be. So I think a working group will come back and give those recommendations, and not presuppose it's going to be in it. So anyway, that's why I'm supporting it, and let's get on with it.
Any further discussion? We've had pretty good success with our working groups. I think administration would attest to that. So I'm going to be supporting the motion. All in favor? Against? All right, 2 against. Carried. Madam Clerk.
We are looking at the unfinished business listing for January 11th, and we are looking for a motion for council to receive the listing.
Councillor Duppel, seconded by Councillor Grant. Any comments? Councillor Bennett, go ahead.
Thank you, Madam Mayor. I'm just looking at the unfinished business motion listing, and I'm wondering if we shouldn't be putting a date on the remote worker attraction strategy. Considering the times we are in right now, and more people are working from home, I think now is the time we should be looking at how to keep those people, or those people that are going to transition to that permanently. How are we going to get them to live here?
Madam CEO, do you have a comment about timelines, or if you have any status updates on that committee?
Thank you, Madam Mayor. No, I don't have any status on that committee. I believe the committee has met a couple of times.
They have.
So perhaps we could ask the committee.
I think I don't see Councillor Bergeron on screen, but I see Councillor Towndale and Councillor Gardner. Councillor Towndale, did you want to start?
Well, Councillor Bergeron is the chair currently, I believe. He mentioned that he was interested in that, so I let him have it. But right now, we're still working. I don't have any updates to report currently. We're still kind of moving forward and looking at what the goals we want to set are and how we're going to achieve those goals. But I assume he's still here in the meeting, so I'm hopeful that he can
come back to the meeting. So I'll update him. Did you have anything else, Councillor Towndale? No.
No.
Councillor Bergeron, we started talking about the remote worker group, and Councillor Bennett's suggestion is, or question is, around a timeline, maybe setting a timeline on that unfinished business list. And so Councillor Towndale has deferred to you as the chair of that group. Councillor Bergeron.
Sure. Yeah, we've definitely fallen behind, and it's good that it's been reminded. The idea was to get something by budget. That just wasn't able to happen. We've met only once. We do need to meet again. It certainly has fallen off the radar a little bit. I do think it's a pretty big undertaking, so thank you for bringing it up. If I have to put a timeline on it, I would like to see in the next 3 months or so the open house that we wanted to do, or the virtual open house, I suppose, with feedback from people, sending out a survey to the community, and then presenting some ideas to council. So let's put a 3-month timeline on it, if everyone's okay with that.
I see Councillor Bennett nodding. Madam CAO, is that a possibility?
Sure, it's whatever council would like.
Right. So I have Councillor McDonald, who had raised her hand, and then Councillor Gardner. Councillor McDonald.
Thank you, Madam Mayor. And I didn't raise my hand with regard to this issue, but it's with regard to the item regarding locomotive stabilization initiative.
Okay, before we go there, I just want to finish on remote work.
Okay.
Councillor Gardner, I think you believe you're a part of that committee as well. You're muted. There you go.
Okay. We've had one preliminary meeting, really, a Zoom meeting, and we just to start to work on the remote workers. There were a few groups that we wanted to meet with, or that we brought up at the meeting, and yeah, we are a little delayed, so just hang in there. We'll get it done.
Thank you for that. I see consensus from the faces on the screen around a 3-month timeline, so that makes sense. I do want to highlight that the city conducted an open house for the organics program last week, and did so through Facebook Live and various ways of doing an open house, and it was quite successful. So there are all kinds of ways to, even during COVID, canvas, survey, and actually have some pretty interesting discussions. So just putting it out there. Councillor McDonald.
Thank you, Madam Mayor. Given that there is a motion in the agenda regarding the locomotive that might actually get resolved before budget deliberations, I hesitate to vote in favor of the unfinished business listing now, because it says that the locomotive will be put on to budget deliberations. And since it's been a feature of every budget deliberation since I've been on council, I'm kind of hoping we can maybe clean it up next meeting, which would be before budget deliberations.
I'd like Madam CAO to respond to that.
So do we want to, so there's a new business motion on the agenda tonight. I think we can deal with it whichever way council would prefer. If we want to defer that to budget and deal with it at budget, because we'll have staff prepared to do that? The timing would be fine, or do you want it to come back in a report at a regular council meeting?
If you're asking me, Madam CAO, through you, Madam Mayor, I would love to see it come up at our next council meeting if we can, because then whichever way it's decided, it'll be taken out of budget. Because as I said, it's a regular feature of budget. And it's just, we keep continuing to kick the ball down the road. We never make the decision. So if we can get the 3 reports we need to make a decision at our next council meting.
So that's, the timeline is of concern there in terms of getting information, but I'd like the CAO to speak to that.
Yeah, so our, like trying to work on, although our council meeting is 2 weeks away, those reports are really wrapped up, you know, almost a week from today, or they need to be substantially to get on the agenda. What we can do is we can aim to start to work on the information. If we can't have it ready at the next council meeting, we'll have it ready to go to budget.
Okay. Thank you.
Councillor Gardner.
My position has never changed since Councillor McDonald and I brought that up 2 budgets ago. And I wanted to get rid of it or fix it. And no one's come forward since then. So somebody wants it in Smith Falls, let's get it done, bring it to the next council meeting. After that budget meeting, when that was brought up and I called it a rust bucket, I think the train ran over my back later on because people were upset because it was a heritage issue, it was a historical issue, but nothing got done. Thank you for those who put that the motion forward to get it done, and let's get it done as soon as possible.
Thank you. Any further discussion here? Councillor Mack, we are talking about the unfinished business listing.
I'm talking about the locomotive.
Well, we're going to come back to that.
We'll come back to it. That's why I'm fine with that.
Thank you, Councillor Mack. Madam Clerk, there was a mover and a seconder for the unfinished business listing.
There were. Councillors Dupel and Grant.
Any further discussion? All in favor? Against? Carried. Madam Clerk.
So now we're going to go back to our consent items that we moved to communication for discussion. The first one is Belford Estates Subdivision 2, with a recommendation that Council approve Phase 2 of the draft plan of subdivision as outlined in this report, and B, that Council approve the application to rezone the subject lands from manufacturing 20 with a hold to residential 20 with exceptions, as outlined in this report.
Moved by Councillor Grant, seconded by Councillor McDonald. Discussion? Councillor Hollingsworth.
Thank you, Your Worship. A little gap there. I really don't want to belabor this. I wanted it pulled out of consent because I want to vote against the recommendation. I want to vote against the resolution. I want to vote against the bylaw simply because I don't know what's underneath the soil. There was an issue with regards to the fire hall just recently. Even when we, at the PAC meeting, for those who were present, may recall when we discussed possible contaminants, one of the members of the community said there was a contaminant that isn't even on MOE specs right now that nobody seemed to be able to identify. If it was going to be a park or a baseball diamond or a golf course or something like that, I could probably see myself approving it. If we were talking about running a road through there to try to open up traffic, I'd probably support it. But the idea of residential component built on that property without a clear idea what this contaminant was and what the long-term possibilities are, I'm afraid that I just can't support the recommendation or the motion, I guess, to rezone it and allow this subdivision to move forward. So short and sweet, I just don't know what's underneath the ground, and I don't want to see Cornwall having to deal with something 15, 20 years hence, so I'm not going to support the recommendation. Thank you, Your Worship.
Councillor Bergeron.
Thank you, Madam Mayor. I echo what Councillor Hollingsworth said. This was more procedural for me. I voted against it at PAC. It didn't make sense for me to vote on it as part of consent. I am curious why it's also a resolution, but that's maybe just, I just don't understand why it would be both. So I'll be voting against it here in communications.
Councillor McDonald.
Thank you, Madam Mayor. And I'd like to speak in favor of the resolution. Given that we've had assurances from the developer and from the MOE that if anything is found, the developer will be held to remediating it. I think that's good enough for me. This is not a nuclear blast zone. This is an industrial wasteland, and there's been a tremendous amount of cleanup, and there are processes in place to ensure that if further degradation is discovered or there's ongoing environmental issues, that they will be dealt with before the development continues from the point at which those things are discovered. And I think that's the best we can do, or we abandon these sites forever. So I'm obviously in favor of the resolution.
Councillor Grant.
Thank you, Madam Mayor. I think the developer has completed his due diligence. There's been no negative reporting that we actually heard from the MOE or the developer or any other studies. And worrying about something that may be there in the future is, and just, we did our studies earlier when we looked at the future arena site, and a lot of that was brownfield, or not brownfield, but greenfield site. And to me, just worrying about something that may be there is not enough to discourage me from moving ahead with this development.
Councillor Gardner.
Thank you.
No, you're muted.
Yeah,
there you go.
Okay.
Yeah, go back. There you go.
Okay. On page 27 of the report, I may have missed something, but it says the easement also contains the main storm sewer, which ultimately outlets to the St. Lawrence River. Is that a fact, or did I miss something?
Mr. Boileau.
I believe what they're referring to there is if you go to page 42 in the agenda, it's also identified as page 23, but it's the larger plan. And I believe what they're speaking about is the easement that would exist on the east side of the future Netcanab Drive that would contain a sewer that finds its way all the way down to the south through the entire length of the project.
Thank you. I thought I had seen that, but for some reason I couldn't find it when I went back. So thank you for that information.
Okay, you're welcome.
Any further discussion? All in favor? Against? 3 against. Carried.
So then now we should probably deal with the resolution on the same matter since we skipped it. Now therefore be it resolved that Council enact that the application dated June 9, 2020 from Marc Brisson to subdivide the lands as shown on plan of survey dated June 10th, 2020, prepared by Kim Adams, be given draft plan approval, subject to fulfillment of the draft plan conditions listed in Appendix A to this resolution and articulated through an executed subdividers agreement and zoning bylaw amendments being in effect.
Moved by Councillor Grant and seconded by Councillor McDonald. Any further discussion? All in favor? Against? 3 against. Carried.
The petition, traffic on Riverdale Avenue, with the recommendation that council refer the petition on the traffic on Riverdale Avenue to administration for a report.
Moved by Councillor Grant and seconded by Councillor Gardner. Discussion. Councillor Bergeron and then Councillor Towndale.
Yes, I wanted to add a date to this report. I don't want this to linger. This has been a subject that I personally have been dealing with for almost a year now. I do know that we have a lot of information on this specific item, that this is not new, that there have been many requests for information. I had raised my hand to make the motion. I would like to see this have a return date sooner than later. Looking at our next council meetings, I would ask the motion maker to add a timeline of January 25th is our next meeting. Is February 8th the meeting after that?
Madam CAO?
Yes, February the 8th is the next meeting after that.
So I would ask that the motion maker add February 8th to this report if possible.
Is that a timeline that administration can deal with in terms of analysis and try, because there's information already in the file, correct? Madam CAO?
So Madam Mayor, maybe if I could maybe have a moment to just speak to a few comments. There's multiple petitions that are circulating right now in the Riverdale area. This one is with respect to traffic on Riverdale Avenue, but there's also a couple of other petitions that we're anticipating in the north end of Riverdale and with respect to the 9th Street extension and other activity. And then also to, there's development that's occurring on the north end of Riverdale. So in discussions with my team, we were looking at, I think, putting together what we thought would be a presentation for council on what's going on Riverdale to deal with maybe all of the petitions all at the same time and provide council with an update on the construction activity as well. So if council is agreeable to that, because we know that we have another petition that I think is in the works that's coming forward to us as well. So it might be a better opportunity for council to look at all of the issues at Riverdale at the same time. We would likely be able to bring that forward, I would say, at if it's not the February 8th meeting, we probably could bring it forward at the meeting following that.
Councillor Grant, you made the motion.
Even though I made the motion, I agree with the CAO that perhaps if somebody would want to defer this until we get all the petitions, because there are other problems with that. Mainly the road is a mess. It's like a washboard from the heavy equipment that Grant used to for that subdivision. But if somebody would put a motion to defer it, then I would support that as well.
All right, so is there a motion to defer? Councillor Bennett, seconded by Councillor Gardner. All right, so we're now debating the motion to defer. Okay. Councillor Holling, oh, no, wait. Madam CAO?
If I may, Madam Mayor, I don't think we need a motion to defer. I think what we need is just flexibility on the date, and we'll coordinate all of these Riverdale items and bring them back in a presentation to council.
Councillor Bennett and Councillor Gardner. Okay.
Yeah, I'm okay with that.
Okay. Okay, so we're back to the original motion with some flexibility to the date, but it's looking like potential February, end of February. Is that fine?
I'm good with that.
All right, so now we're still debating the motion. Councillor Hollingsworth.
Thank you, Your Worship. Just to make sure I know, so does that mean that the residents on Riverdale Avenue and those with this other pending petition, can they realistically expect to see some kind of action taken by the end of February then? Because if people meet me on the street and say, hey, Dean, what's going on with Riverdale? You know, we've got this traffic issue, which I think is valid. You know, like, when are you going to fix it? So can I tell them that we can expect something by February, the late 20th or 22nd or whatever the date is? Does that sound reasonable?
Madam CAO?
So through you, Madam Mayor, yes, we would have a report or a presentation that comes back to council at that second meeting in February.
Okay, thank you, Your Worship. Thank you, Madam CAO.
Any further discussion on this motion? Councillor Towndale.
Thank you, Madam Mayor. I had a question about the petition.
Sorry, I overlooked you.
No, that's quite all right. I've seen military documents with less redaction than this. I mean, why are the names redacted? We've had petitions from different parts of the city where residents are specifying certain streets. So in essence, you could argue they're sort of giving up where they live, but realistically, anyone can look this information up in a phone book, which still exists, or Canada 411 online. So, you know, I think it's a little ridiculous to look at this and not see who signed it. I mean, you know, if we can get it sent to us, you know, separately, that's not redacted, just so that we can see it, that would be appreciated as well. But I think, you know, when they come to the council, at least the name should be visible.
Madam CAO?
We'll refer it to the clerk.
There is a petitions policy in place.
Your point is well taken, Councillor. The names probably should have remained with the addresses and contact information redacted, with a copy sent to council. In our hurry to try to organize this meeting, it slipped our minds. So my apologies. I take responsibility for that. And the entire policy, or the entire petition, will be sent to council tomorrow morning, first thing.
Okay, thank you very much. I appreciate that.
Any further discussion? Councillor Bergeron?
Thank you for letting me speak again. I just want to highlight that the petition does, one of the items it's asking for is that bylaw be enforced. Of course, that should be the case for all of our policies. I'm hoping that between now and the time the report comes out, there's enough information of whether that bylaw is being enforced properly or enough comes with this report. I didn't see it in the motion, but I assume that that's part of the case.
Madam CAO?
We'll make sure that we include that in the report.
All in favor? Against? Carried.
RFP 20P20, Design and Construction Administration Services for the Affordable Housing Complex. The recommendation is this RFP be awarded to IBI Group Architects, Incorporated from Kingston, at the total bid price of $679,426.06, including provisional item for Phase 2, Construction Administration for Building B.
Moved by Councillor Duppel, seconded by Councillor MacDonald. Any discussion? Councillor MacDonald.
Thank you, Madam Mayor. And the reason I pulled this is because there's a reference here to design, and I'm glad to see that Melissa Morgan is still with us at the meeting, because I want to flag the concern I have that we said we were going to base this design roughly on what we did on 6th Street with the affordable housing complex. And I asked previously if we could possibly have balconies on these apartments. And I believe Ms. Morgan said that would depend on the cost. Well, I hope when this firm is doing the designing that they do give us a cost that includes a balcony for each apartment. And without too, but at least with the balcony, so that we can decide whether or not we will have balconies, because I think this is a great new venture on our part, building these units, and balconies I think are pretty considerable amenity for most people.
Ms. Morgan?
Through you, Madam Mayor. Yes, certainly. I have written down Councillor McDonald's previous comments on balconies, and certainly when our committee meets with this architectural firm, we will advise them of the recommendation to possibly include balconies in the design if it's financially feasible, as well as feasible within the design. Because there are other amenities and houses around there that we would need to consider in that design phase as well.
Thank you very much.
Any further comments? All in favor? Against? Carried.
Now we are going back to new business items, Madam Mayor. The first one is vacant properties tax. Now therefore be it resolved that Council direct administration to prepare a report on the feasibility of implementing a vacant properties tax.
Moved by?
That was Councillors Sid Gardner,
Am I unmuted? Yeah.
You are.
Sid
Who's the
Gardner
seconder?
and Dean Hollingsworth.
Seconder. Yeah, that was Dean Hollingsworth.
Okay, Councillor Gardner.
I took the definition of what it came from Vancouver itself, because Vancouver, Ottawa, and Toronto are moving to do this. And they're properties that are considered to be vacant if they have been unoccupied for more than 6 months during the tax year. Failure to make a property status declaration will result in being deemed vacant and therefore subject to the vacant homes tax. And that's pretty well in the motion. The vacant tax, home tax, is used to motivate owners of empty and underused homes to rent out their properties and increase the rental housing supply. Revenue from the empty homes tax would be reinvested into affordable housing initiatives in the city of Cornwall. The tax would be, right now in Vancouver, is 3% of the assessed value. And because we're a small city, I really hope that this is feasible. And I think we could, if we have enough homes that are vacant, that we can make some money and put it towards our affordable housing. That's it. Thank you.
So I have Councillors Towndale, Bergeron, and then Hollingsworth. Councillor Towndale.
Thank you, Madam Mayor. Well, I understand the intent of the motion, especially for Vancouver and Toronto. I mean, at this point, they need the room. You know, being a bit familiar with the housing market in Toronto, as I owned property there at one time, it's a little busy, and there are some properties that are vacant, and there is an issue with rentals. I'd say more so than here. House prices are exceedingly high in both cities. This isn't a secret. They're the two most expensive cities in Canada, so people are having trouble buying. I know we're starting to see that here a little bit, but I don't think it'll get to that point. Ottawa is starting to get there as well. I don't think construction of new units is kept up. You know, I understand that this looks like it would target residential properties, but my concern is with commercial properties. You know, in 2017, 2018, we eliminated the vacant tax rebate for commercial. So I think it phased out this year. This was the last year, if I'm not mistaken. And what's going on right now, though, with the pandemic and everything, there's a lot of vacant commercial space. Well, not a lot of vacant commercial space. I shouldn't say that because that's not exactly true, but there's vacant commercial space. And residential, I know it exists, but I don't think to the same extent. We're seeing developments. We're seeing subdivisions being built. We're seeing new life being put in older neighborhoods. So I don't think this is the time to put something like this in. And quite frankly, I don't think we're the right size for this. So I know this is asking for a report, but I'm not going to support this motion because I don't think this is something we should be exploring. And I think our administration's time is best put elsewhere. We have a lot on this agenda, for example. I think realistically, thank you. And realistically, I think the best way to get these vacant spaces filled isn't to put a tax which will cause people to try to rush and fill them. It's to really continue working on our community improvement programs and the other programs we have that encourage renovation and upgrades to existing buildings so that they get the updates that they need to be modernized and become more livable or more aesthetically pleasing. We've seen some great success with these programs, and I think that's how we should continue here. I don't think we should be penalizing landlords for having empty spaces. So that's just the way I see it. So I'll be voting against this. Thank you.
I have Councillors Bergeron, Hollingsworth, DePel, and McDonald. Councillor Bergeron.
Thank you, Madam Mayor. For the same reasons that Councillor Towndale just outlined, I'll be supporting the motion. I want to see the report. I want to talk about it. I want to debate. This isn't the place to do that today. This is about the report. I do kind of agree that this may backfire in terms of commercial properties. I don't think we have a huge issue in this regard. I think we have very specific issues relating to vacant properties, but I don't know that an overreaching bylaw is the way to do it. I do support the report. I do support the idea that we look at this in more detail. I would most likely, though, without more information, vote against tax in general. They're two different things. Thank you.
Councillor Hollingsworth and then Councillor DePel.
Thank you, Your Worship. I think the key part to this motion is it's asking for a report. So I'm not obliging, or Sid and I, or Councillor Gardner and I are not obliging council to make a decision in a vacuum. We're looking for information. The other reality, at least based on our economic development and area housing, have suggested we have a shortfall of places for people to live in this municipality. In fact, so much so, it is potentially stunting economic development in the municipality as well. So that being said, anytime we can look for a way to solve a problem, I think we need to pursue it. It may be when the report is written, it's not practical, it's not feasible, it's not doable, it doesn't work for us. But I think at the very least, we need to investigate it. And quite frankly, I'm not currently, based on my the knowledge that I have, I'm not qualified or don't feel comfortable making a decision about whether to implement a tax or not. That's why I'm supporting the idea of a report, so that we can have a good, valid, meaningful discussion. Thank you, Your Worship.
Councillor DePel and then Councillor McDonald.
Madam Mayor, I echo Councillor Bergeron's comments, and I encourage the report and look forward to it. So thank you.
Councillor McDonald and then Councillor Grant.
Thank you, Madam Mayor, and I look forward to the report. I think that it's time we investigated moving on empty storefronts, especially some that have been visibly vacant for years, and possibly the properties of absentee landlords. So I think that should be a topic covered when the report comes back, which I welcome. Thank you.
Councillor Grant.
Thank you, Madam Mayor. I'll support this, the motion. There's no date on when the report has to come back, so it can fit into the schedule of who's ever responsible for this report. And I'm interested in the subject as well. I'm not very familiar with it, so I'm looking forward to a report.
Any further discussion? Councillor Mack.
Just to clarify something, we're talking about commercial and residential?
It looks like the motion is inclusive of all of those properties, yes. Madam Clerk, is that correct?
That is correct, Madam Mayor.
Councillor Mack?
I wouldn't support the commercial side of it. It's tough enough. There's plenty of commercial space in town, and people are having trouble renting it. And, you know, not interested in that side of it. So I'll vote against the motion because of the inclusion of the commercial space.
Any further discussion? I'm going to agree with Councillors Bergeron and Councillor Hollingsworth. That makes me smile. It's always important to get information and get a report. And so I agree with both of you. All in favor? Against? 2 against. Carried.
The next new business motion is moved by Councillors McDonald and McIntosh, donation of locomotive number 17. Now therefore be it resolved that Council direct administration to prepare a report which would include the following information: how the City of Cornwall acquired Locomotive 17, with details of any obligations we assumed at the time, and a summary of the care we have taken in its regard. 2, the continued willingness of the Railroad Museum personnel to accept Locomotive number 17 after they have had an opportunity to assess its current condition. And 3, the cost of transporting Locomotive number 17 to the on-site sheds at the Smith Falls Museum where the refurbishment would take place.
Moved by
Councillors McDonald and McIntosh.
Councillor McDonald.
I think the call for a report is self-explanatory, Madam Mayor. This has been an issue that has plagued us for years, and I think it's time we moved, because unfortunately, while we can delay, the locomotive is suffering the effects of time, and it is decaying before our eyes. So I think we have to make a decision about this quickly. So, and that's what the motion calls for, a report.
Councillor Gardner.
Yeah, there we go.
Yeah, you're good.
Yeah, I did it finally. The old brain's working. Anyway, one of the things that I brought up the last time that was discussed was the fact that that piece of property that train sits on would be a valuable, I think, asset to sell to a small business or a restaurant or somebody who needs parking space nearby. And that was the other reason why I wanted it out of there. So that's all I have to say about that. Thank you, Mrs. Mayor, Madame Maya.
Any further discussion? Councillor Bergeron, I had noted, and then Councillor Mack. Go ahead, Councillor Bergeron.
Thank you, Madam Mayor. My question is, would this report be at budget? Because I believe that was the conversation when this was brought up at the last meeting.
Yes. Where's Madam CAO? Go ahead.
So through you, Madam Mayor, yeah, if we cannot have this ready for the next meeting, we'll have a report ready for budget at the first part of February.
So specifically, I would like it to be at budget. I would like this to be a budget conversation. I don't know why we're preempting budget by a week. I would just ask the motion maker to add that this report be at budget and it be discussed in the context of our budget. This is all related to whether we want to keep this or not.
That would be fine if council would like to amend that to reflect that it gets dealt with at budget. That's fine with administration.
So I have to go back to the mover. Councillor McDonald.
Thank you for the consultation, Madam Mayor. I think that we have endlessly discussed this at budget regularly, and where we pay lip service to the value of our industrial heritage, we have never demonstrated the will to actually act on it. And right now we have a party very interested in acquiring the locomotive, but that offer obviously depends on the condition of the locomotive. And I think that our history of what we have done with the locomotive shows that we don't have the will to do right by this by ourselves. And I'd rather not, I don't see an advantage to doing it at budget rather than before. In fact, I see an advantage to keeping it out of budget, because budget has never been an effective way to address it in all the years that we have brought it up at budget time. However, if the reports can't be ready by our next meeting, then obviously we'll have to go to budget, which I think will be regrettable.
So you're not changing your motion, Councillor McDonald?
No. I mean, my motion, of course, depends on whether the CAO and administration can get these reports in.
Yep, understood. Okay, I have Councillor Mack, and then I believe I had Councillor Hollingsworth that motion? Yeah. All right, so Councillor Mack.
Yeah, in reference to Councilor Gardner's suggestion that we sell the property, might want to do a soils test on that property first. Anyway, it didn't go to, my first thought was to send it to budget, but if the report can come in for the next meeting, fine. Question through you to Mr. DeWitt. Is he still with us?
He must be.
Bill?
Just want to remind council of the time. Mr. DeWitt?
Maybe CEO. I'll ask the question. I believe some time ago we had stuffed away $100,000 in a budget for stabilizing this piece of equipment. Was that $100,000 ever used?
Through you, Madam Mayor. So I think we have Mr. DeWitt up now, but we had set up a motion from council to fund it from working reserves, and then it would be paid back, because at the time we weren't really sure on what that estimate would be, and I think we were worried it was going to be more. So by setting it aside to be funded from working reserves and pay it back, didn't have a budget implication. Okay. There isn't funds sitting aside in an envelope anywhere for the train.
Okay, I get you. Okay, so I was under the mistaken impression that money had been set aside. We hadn't used it. It was an overcarry. So any money would have to come out of budget. Okay. I think it's going to end up with budget anyway.
Councillor Hollingsworth.
Thank you, Your Worship. First of all, a quick question to Ms. Bailey. Did we not put the first year of this term, I thought it was $150,000 set in the budget to moving the rail car from 9th Street. And I had thought tentatively in that open gap between the complex and the park. Did we not put was there not a discussion or some money set aside for that?
Through you, Madam Mayor, further to the CAO's conversation, we have set aside $100,000, but never removed it from working reserves because we didn't know what steps we're going to take forward. So $100,000 was approved to be funded from working reserves and to pay it back the following year. Those have not been utilized and have not been taken from working reserves.
And that was to move it from its current location to somewhere else. I thought the recommendation, or at least maybe it was just somebody suggested it, somewhere close to the civic complex. Is that making some sense?
Mr. DeWitt would be best to answer that.
Mr. DeWitt?
Through you, Madam Mayor. There was actually a report that indicated that we would looked at a couple of locations near the civic complex. There was costing associated with that, and yes, they were all in the range of $150,000.
Okay.
But if my recollection is that council did not move forward at the time, and that they wanted to go and talk to some of the community groups that were interested in saving the locomotive or refurbishing the locomotive to see if they could obtain some funding from the grant sources.
Okay.
And I don't think that, and I think that's where it was left. I don't. There was a search that went forward through the Moccasin Club, which is a local train enthusiast group, and I think they came up empty-handed, and so it kind of stalled there. But I think the next report that Councillor McDonald is requesting will kind of address a little bit of history, and it'll be a little bit more clarifying.
Okay. Then perhaps a quick to the Madam Clerk, if you could, and it doesn't have to be tonight, but I'm going to probably vote against the motion, but if you could maybe in the course of that report see if there actually was an approved motion of council, because I thought there was, and maybe I'm not, something at budget with regards to whether we actually put money aside to move it or whether it was just, well, like, let's go and investigate it. I don't remember the motion. So I'll just kind of stop that train of thought. Get it? Train of thought. Anyway, sorry, had to get that one in there, Your Worship.
Councillor Hollings.
I'll be quick. I'm not going to support the motion because it's not going to make it to, because it doesn't say to refer to budget. I agree with Councillor Bergeron. I think it should be a budget item. The fact that we're going to try to do it before budget, I'm not a fan. The other thing is I'm not a real champion of getting rid of heritage, any heritage. I mean, let's face it, the old cliche was if you want to get rid of a building in Cornwall, put a heritage designation on it. That's kind of how we do it here. And we've gotten rid of enough of it as it is. So I'm not going to support it. I'd rather kind of pursue some other avenues. So anyway, that's enough. Thank you, Your Worship.
Councillor Towndale.
Thank you, Madam Mayor. I wasn't going to comment on this, but I am going to vote against it as well. But Councillor Hollingsworth raises a good point, because this locomotive, I know we're not debating that part tonight, but it happens to be on the register of the Ontario Heritage Trust, and it's one of only 2 properties in the entire city, which are, the other one being the Cornwall Public Library. So I find that interesting that in 2006, I believe it was, the city thought enough of the locomotive to voluntarily name it to the list, the register maintained by the Ontario Heritage Trust. And yet now, you know, we're thinking, hey, let's get rid of it. And so then maybe we'll have one location in the city which is designated under that list, you know? So anyways, I'll save the rest of my points for the time when we debate that, because I know it's coming one way or the other. Thank you.
Can everybody hear me? Okay. All in favor? Against? 3 against. Carried.
Okay, Madam Mayor, pursuant to our procedural bylaw,
Yes.
after 10:50, we should get a motion to continue after 11 o'clock.
Councillor Towndale? Councillor Bennett? You're making that motion? Any discussion? Just want to say I thank you all for your patience. This has been extraordinarily long. I appreciate you hanging in there. Too long. All in favor? Carried.
Our next new business motion is the pandemic lockdown. Now therefore be it resolved that the City of Cornwall requests the Eastern Ontario Health Unit and Province of Ontario to enforce businesses that are allowed to be open for in-store purchases only be allowed to sell goods or services deemed essential to in-store customers. That was moved by Councillors Bergeron and Towndale.
Councillor Bergeron?
Yes, thank you. I'm not going to speak too much to this. I think we had a really good debate about it earlier, understanding that Dr. Paul couldn't be part of this debate. I still think it's an important motion to pass. It sounded like he agreed with that. This does also recommend that we speak to the province. The same for the next motion. So I'm just going to leave it at that. I support it still.
Councillor Towndale.
Thank you, Madam Mayor. Ditto. I mean, I'll be quick since we are dragging on time, but I think it's important that we keep this motion as well. Thank you.
Any further discussion? I will say the same. I've been hearing constantly from people about this issue. And of course, this type of motion does help us to add our voice to all of the voices that are speaking to the province. So I understand the intent and agree with the intent of the motion. All in favor? Against? Carried.
Detailed COVID-19 reports. Now therefore be it resolved that department heads present their departments, I jumped to the wrong one. Now therefore be it resolved that the City of Cornwall requests the Eastern Ontario Health Unit to release data on cases by industry sector, such as retail stores, restaurants, fitness centers, recreational facilities, barbers and hair salons, small businesses, schools, healthcare, distribution centers, and manufacturing, public sector, grocery stores, among others. Moved by Councillors Bergeron and Hollingsworth.
Councillor Bergeron.
Thank you. Same discussion here, that I think we had a pretty thorough discussion and debate about it. I would just point out, though, that in this case, council votes by motion, and this was submitted on Thursday. And from the time it was submitted to today, there was a really good conversation that happened within our community as a result. We move a little bit slower than some other agencies. So I still support this motion. I'm glad it was discussed thoroughly today with Dr. Paul.
This discussion has been going on for a long time, Councillor Bergeron. Our council spoke of this before Christmas.
I appreciate that.
Okay, so it's not just in the last 4 days. Councillor Hollingsworth. No further comment? Councillor Hollingsworth? Councillor McDonald.
Thank you, Madam Mayor. I frankly think the motion is redundant. We had the discussion, and I think we had a very good report from Dr. Emiliotis. And so, I mean, I don't want to vote against it because it's not a bad idea. But as Councillor Bergeron said, I think we've accomplished our goal that we would have if we passed this motion. And it's almost like harassing the Eastern Ontario Health Unit now to ask for what they've already given us.
Any further discussion? I am going to support the motion. I do not think it is redundant. I think that it distills a lot of conversation that has been going on in this community. I want to suggest that you look at what Nova Scotia has put out. It's remarkable to look at that information and the level of detail. Now, I'm not saying that Dr. Paul and the health unit are not going above and beyond. I'm not saying that at all. I don't think that this motion is saying that either. I think this motion is a reflection of what is being said and what is being requested in our community. And so I appreciate that it's on the agenda. Councillor Mack, did you want to add something?
Well, the motion was a response to a lack of data. So we got that tonight, but when the motion came, we weren't getting what we thought we should be getting. So
correct. And correct. And I heard Dr. Paul say, in fact, that there was more information coming, that he could provide more granular data. So I liked hearing that part as well. Any further discussion? All in favor? And against? Carried.
Next on the agenda are the bylaws. So the first bylaw was separated to be voted on separately, and that bylaw is for the rezoning of Belford Estates.
Moved by Councillor Bennett and Councillor Grant. Any further discussion? All in favor? And against? Against. Carried.
Bylaws 2021-002 to 007 inclusive, listed on the agenda, are being presented to Council for adoption.
Moved by Councillor Bennett, Councillor Duppel. Discussion? All in favor? Against? Carried.
Next are reports from standing advisory, special, and ad hoc committees of council.
Any reports from committees of council? Councillor Gardner.
Not so much a report as a comment that Dr. Paul made that really upset me, because I went through the before Christmas, Eastern Ontario Health Unit, distancing properly, wearing a mask. And one of the things that the employees who are busting their butt and working 24/7 said to me that they were fed up with, when they contact tracing, being sworn at, being rude to them, when at the end of the day, all they're trying to do is stop the spread of this bloody virus. So please, anybody out there listening to this, they're doing the best that they can with what they have. That's all I have to say. Thank you, Madam Mayor.
You are the chair of the Eastern Ontario Health Unit, and you have every right to report that and to comment on that. Thank you for raising that issue. There is pandemic fatigue everywhere and in our community. And it does mean that people who are working in the sector are putting up with quite a lot. So I appreciate your comments. Any other reports from standing committees? Madam Clerk?
Our next on the agenda is the notice of motion, budget presentations, moved by Councillors Bergeron and Hollingsworth. Now therefore be it resolved that department heads present their department's operating budget in detail to Council during budget deliberations at the same time as their capital presentations. Now therefore be it resolved that presentations should include a description or reason for any line items or staffing that have changed from year to year, as well as an overview of the department's past year and coming year in terms of operational issues and goals.
So that is a notice of motion that will be debated at the next council meeting. Thank you, Madam Clerk.
Next is the confirming bylaw, 2021-008. We're looking for that bylaw to be adopted.
Moved by Councillor Grant, Councillor Gardner. Any discussion? All in favor? Carried.
And adjournment, Madam Mayor.
11:02, folks.
On a record.
Yeah.
Close.
Encore une fois, merci pour votre patience. Thank you very much for your work this evening. Much appreciated. Motion to adjourn? Councillor Bergeron and Councillor Dupel. Have a good evening. Please be careful. Please tell your neighbors and family. Thank you to administration for their work tonight as well. Take care, everyone. Stay safe, please.